Good morning, everyone. Can I ask to take seats? We are 9:15, which is exactly the timing that we have foreseen to start our conference. Therefore, please take your seats and then actually we can start. Ladies and gentlemen, good morning. I have the pleasure to welcome you at this 2024 annual conference of Age Platform Europe. Age Platform Europe is actually the largest network in Europe representing organizations of self-advocate older persons, but also those organizations which actually work with and for older persons. So I have the pleasure to introduce this half-day annual conference. I think that we've chosen quite evocative title, Writing the New Chapter of Age Equality in the European Union. Of course, we all know that we are meeting in a very, I think, important moment. We are still talking politics since it's only 2 days ago that we had the European elections. Now the results are already getting, I would say, even more precise. Therefore, we know what will be the future composition of the European Parliament. And of course, this European institution will also have a very important word to say on how questions of equality will be, how this work on equality will be pursued by the next European legislature. Of course, the outgoing European Commission put the question of equality very high in its agenda with this objective to create a union of equality. But at the same time, it's true that EU equality framework runs at different speeds. We do have very comprehensive, ambitious legal protection on some grounds of discrimination, but not necessarily on the others. And certainly ageism, age discrimination is one of those grounds of discrimination where actually we have a clear gap in the protection, in the enhancing age equality across life course, and actually regardless, yes, our chronological age. This is the topic that will be part of our discussion today. Very quickly, because it's true we are also followed by participants who follow us online. My name is Maciej Kucharczyk, I'm Secretary General, and once again, very warm welcome to all of us. Before we will start with our opening panel, I will just give you also a little bit more information on how today program will look like. After our guests who are already sitting next to me representing Belgium, which is the country right now in the role of the presidency of the Council of the European Union, and we've got also with us the representative of the European Commission, of Vice President for Democracy and Demography. So of course we will just come back to both of you. But after this panel, we will have more, I would say, in-depth discussion. We will have two thematic panels. One, because it's true, we would like actually to look a little backward. So how so far the question of equality, the achievements looks like between all different actually institutions, stakeholders, which actually have a role in enhancing equality, also including in old age. Then we will try to use maybe the expertise to get inspiration from other equality networks like Us Age in other grounds of discrimination to see if we can learn something from, as I said, more ambitious frameworks to promote equality for other age and population groups. And then we will end, of course, looking forward, how we would like age equality look like, what are the possible actions. And I have the pleasure to announce, it will be later on in the program, and later on Polish minister in charge of senior citizens will join us. And I think it will be a nice connection because on one hand side, we've got the current EU presidency. And as you know, it's a 6-month role that each of the EU countries actually takes. Within a year, it will be actually Poland taking on this role to moderate discussions within the Council of the European Union, and therefore we will have Polish ministers. So I think it will be interesting as well to see what kind of legacy on equality in old age we can have in between the current Belgian presidency and the upcoming presidency of the European Union. Maybe some also housekeeping rules. Of course, we do have interpretation, English, French, Italian, respectively. I think it's channel 1, 2, and 3. Is that correct? No, I can see that actually I've already mixed up. But the interpretation, English, French, Italian, that's true, right? No, sorry, English and French. That's it. Then we will have, in principle, a half an hour, 30-minute break around 11. And I've been also told, is this confirmed that we will display the smart against ageism game? Is this something? Yes. So actually, my colleagues will share with you more information later on. And maybe also we thought we always insist on this in this kind of public debates on aging, on older people. We think that because words count and actually words have the power, age made a substantial actually effort to produce what we call some guidelines on inclusive anti-ageist communication language. Let's take, for example, and it's true, we heard this term yesterday a couple of times when we refer to older persons as elderly. Well, actually, this term, we don't really like it. Why? It's simply because it's actually too close to frailty. And actually, older people, they are not all frail or vulnerable, even if they are, if they have an impairment or any kind of disease, it's not necessarily that they are frail. And therefore, we as Age Platform Europe, we ask very much to actually use terms which are more inclusive. So let's as well follow these guidelines today to refer in between us in the terms which actually empower everyone and don't, let's say, insist on any weaknesses, prejudices, bias, and so on. Having said that, I think we can move now to the opening panel. As I said, we will start with Mr. Younes Kadour Jebar. You are actually Deputy Chief of the Cabinet of the Belgian Secretary of State in charge of gender equality opportunities, Ms. Marie-Cornine Leroy, who cannot be with us, but I'm sure that we will have actually some interesting and important messages. Therefore, the floor is yours.
Thank you. Mesdames et messieurs, en votre titre et qualité, je voudrais remercier les membres de la plateforme Age, Madame George Ganti et Madame Wadou pour l'organisation de cet événement et pour leur invitation. Cette discussion est l'occasion d'échanger autour de l'importance de faire entendre les voix des personnes âgées et de lutter pour l'égalité à tous les âges. Tout d'abord, considérons la situation actuelle telle que le paysage démographique, par exemple. L'Europe a l'une des proportions les plus élevées de personnes âgées dans le monde. En Belgique, environ 1/5 de la population a 65 ans et plus, et ce chiffre devrait augmenter de manière significative dans les décennies à venir. Ce changement démographique entraîne une multitude de défis et souligne la pertinence d'agir de suite pour garantir l'égalité des chances. La sécurité économique est également un problème majeur. De nombreuses personnes âgées en Belgique et à travers l'Europe vivent avec des revenus fixes, dépendant de pensions qui peuvent ne pas suffire à couvrir leurs besoins de base. L'augmentation du coût de la vie, en particulier dans les zones urbaines, exerce une pression supplémentaire sur leurs finances. Dans certains cas, le fait de devoir choisir entre des dépenses essentielles pour garantir les besoins primaires et des dépenses autres est un dilemme qui ne devrait pas exister. Cette vulnérabilité économique est un échec sociétal que nous devons résoudre. Le logement est un autre problème crucial. Un logement sécurisé, abordable et accessible est un besoin fondamental pour tous. Mais de nombreuses personnes âgées vivent dans des conditions inadéquates. En Belgique, il y a une pénurie de logements adaptés aux personnes âgées. Beaucoup de maisons manquent des adaptations nécessaires, telles que des rampes, des barres d'appui et d'autres modifications facilitant une vie autonome. De plus, la disponibilité des établissements de soins de longue durée est limitée et le coût est prohibitif pour de nombreuses familles. Le transport et la mobilité posent également des défis significatifs. Bien que les zones urbaines puissent offrir des transports publics, les régions rurales manquent souvent de services fiables. Cette isolation peut entraîner une dépendance à l'égard des autres pour des activités de base telles que faire les courses ou se rendre à des rendez-vous médicaux, réduisant l'autonomie et la qualité de vie des personnes âgées. Ou au contraire, cela peut engendrer encore plus d'isolement. Alors, dans ce contexte, que pouvons-nous faire? Les luttes auxquelles sont confrontées nos personnes âgées sont multiples, mais il existe plusieurs voies d'amélioration. La secrétaire d'État, Madame Marie-Colline Leroy, considère cette injustice avec beaucoup d'attention. Selon elle, dans la lutte pour l'égalité des chances, nous devons absolument améliorer la lutte contre les discriminations fondées sur l'âge. Au niveau européen, lors de la présidence belge, une des priorités était de s'assurer d'adopter la directive horizontale en matière d'égalité de traitement, qui vise à compléter l'arsenal législatif européen en matière d'égalité de traitement. En ce qui concerne les discriminations fondées sur la religion ou les convictions, le handicap, l'âge ou l'orientation sexuelle, l'objectif est d'étendre la protection au-delà du domaine de l'emploi, de sorte qu'elle s'applique également à l'accès à la protection sociale, l'accès à l'éducation et l'accès aux biens et services, y compris le logement. En tant que présidence du Conseil de l'UE, la secrétaire d'État a maintenu ses engagements et la Belgique travaille sans relâche pour arriver au soutien unanime du Conseil pour la directive sur l'égalité de traitement qui vise à protéger les personnes contre les discriminations liées à leur orientation sexuelle, l'âge, handicap et la religion ou les convictions dans d'autres domaines que celui de l'emploi. Il est temps d'aboutir pour compléter notre cadre juridique de l'Union européenne et offrir à tous les citoyens et citoyennes la même protection. Hélas, nous n'avons toujours pas obtenu l'accord de tous les pays membres. Il est temps que cette directive voie le jour. Comment pouvons-nous nous assurer que le travail sur l'égalité des chances pour tous nos citoyennes et citoyens continue d'être étendu et approfondi et non pas limité? Parce que comme vous, notre secrétaire à l'égalité est convaincu qu'une société plus égalitaire est une priorité, non seulement pour les personnes auxquelles nous voulons accorder l'égalité des chances et des droits, mais aussi pour tout le monde. Notre secrétaire d'État est convaincu que si nous unissons toutes nos forces, le politique, la société civile, les acteurs de terrain, les militantes, les militants, les personnes qui soutiennent et promeuvent la valeur de l'égalité, ensemble, nous pouvons y arriver. Ensemble, nous pouvons continuer à travailler pour plus d'égalité. En conclusion, les luttes pour plus de justice et de considération des personnes âgées en Belgique et en Europe sont complexes et nécessitent des efforts concertés de tous les secteurs de la société. En regardant vers l'avenir, engageons-nous à créer un monde où tout un chacun est respecté, valorisé et pris en charge, indépendamment de son âge. Le bien-être des personnes âgées n'est pas seulement le reflet de leur contribution passée, mais une mesure de notre humanité présente. Ensemble, nous pouvons construire une société qui honore et soutient en veillant à ce que tout un chacun puisse vivre avec la dignité et la sécurité qu'il mérite. Notre Europe doit incarner l'égalité des chances et l'égalité des genres et la diversité. Elle doit être une vraie union de l'égalité. Travaillons-y ensemble. Je vous remercie.
Merci. Merci beaucoup, Monsieur Dejba, pour en fait ce message de la part de la secrétaire d'État. Vous avez encore une fois mentionné effectivement cet effort d'élargir le cadre juridique européen. C'est un thème, c'est un sujet que nous, en tant qu'AGE, mais également avec les autres réseaux européens de la société civile qui œuvrent à l'égalité, c'est un sujet que nous suivons effectivement depuis maintenant, ça fait bien plus de 10 ans que la proposition de cette directive d'élargir la protection au-delà de l'emploi reste est discutée au sein du Conseil de l'Union européenne. Encore une fois, peut-être c'est un sujet que nous pourrons aussi débattre avec notre invité plus tard dans la journée, la ministre polonaise. Maintenant, je me tourne à vous, messieurs Lamarca. Vous êtes membre du cabinet de la vice-présidente Dubravka Šuica, qui a été nommée il y a 5 ans pour s'occuper à la fois de la question de la démocratie et également de la démographie. C'était la première fois dans l'histoire du Collège des commissaires qu'un portfolio de ce genre a été créé. Maintenant, nous sommes déjà 5 ans plus tard. On sait que la vice-présidente aujourd'hui n'a pas pu être avec nous. Nous avons travaillé en tant qu'AGE avec la vice-présidente je pense, régulièrement ces 5 dernières années. Je vous laisse la parole pour peut-être nous dire un peu effectivement quel est le bilan de 5 dernières années de la vice-présidente dans sa capacité sur les questions de la démographie. Merci beaucoup.
En fait, je suis content pour le fait qu'on vient de parler en français parce que tout simplement, on s'est vu tant de fois tout récemment qu'on peut commencer à tutoyer ici, entre moi et chacun d'entre vous. Mais malheureusement, je n'ai pas le vocabulaire qu'il me faut en français, donc je vais vous parler en anglais. I'm bringing you the regards, first of all, of Vice President Šuica, who unfortunately couldn't be here, although it was foreseen, although it was well written in her calendar, but things have become a bit more complicated this week, and she couldn't join you, unfortunately. We spoke about it last time this morning. I mean, I was about to come to Leuven when I heard maybe we can still arrange things, but then eventually didn't we couldn't. Let's talk about the situation. We're all aware. The working age population is going to shrink by around 57 million before the end of the century. The dependency ratio, non-workers compared to workers, is going to increase in the same period from 33 to 60%. What we've been doing in the past 5 years has been, first of all, to start talking about the fact that we should revise the statistical categories. When we talk about these dependency ratio, I'm not sure we should continue to speak about ages like 65 is the cutoff. No, this is something that, I mean, what we now call working age population should and could and should widen. According to us, at least, that's what we've been trying to push for, including all the people who have the energy and willingness to keep contributing to the society should be possible, also beyond the current retirement age. The concept itself of compulsory retirement age should be discussed, in our view. It shapes our mentality. It leads us to unconscious biases, ageist biases. Workers approaching their 60th birthday are considered to be too old to have a career move. They're considered to be too old to upskill or reskill. They're considered to be too old to be promoted or to invest on within the work environment. This is something we should discuss. I know the electoral campaign is over, but I heard that there are some parties that are still campaigning to lower the retirement age. It's not the commission business. What we talk about is rather avoid it to be compulsory. Then it's something that doesn't belong to our domain, but at least let's discuss whether it should be compulsory or not. So we need to approach retirement as we have been doing with the green paper on aging. In that case, we successfully launched a wider debate in the European Union on the impact of these increased longevity on citizens and for the society as a whole. We ensured that aging became a concern for everyone, not only for older people. By the way, thank you for these communication guidelines, sincerely speaking. I wish it was available also in other languages, because for me, at least in my language, I'm looking at my compatriots, there is no such a difference between elderly and older. So it would be good to have it also in other language, because it could help a wider public. I'm not dictating your agenda for the next 5 years, but just I'm telling you something that would be useful to me at least. Back to what I was saying. The fact that we are living longer, healthier lives creates an opportunity to build a longevity society, which values the longer lifetime spent in older age, empowers older citizens, and nurtures the welfare and well-being of present and future generations alike. So with the concept of a longevity society, we want to build a more positive narrative of a society that is both aging and thriving. And in this context, it is also very important to speak about longevity literacy, to prepare people to the new paradigms of this longer life. But on the other side, we cannot deny, I mean, within the longevity narrative, let's say, we cannot deny that there are challenges related to the current demographic trends, and therefore labor markets, for instance, but also pension systems and the whole care sector should also need a rethinking in order to be prepared. Talking about with pension systems, we just said even too much, but regarding healthcare and long-term care, they must be strengthened. They must become more cost-effective. They have to mitigate old age poverty, and which particularly affects women. And an investment in care is also important to attract talent in the sector. Former carers must benefit from better wages and working conditions. We must provide them with appropriate training and ensure that their profession remains a viable option for them. In the European Union, the Recovery and Resilience Facility stimulates reform and investments with over 48 billion euros supporting healthcare and long-term care. These challenges, notably the ones to competitiveness, led the European Council to request us to deliver the demography toolbox. We spoke largely about the toolbox. I assume everyone is aware of the 4 pillars. One of them is empowering older generations and sustaining their welfare through reforms combined with appropriate labor market and workplace policies. Now, on older persons, the communication calls on businesses and workers to work together, to adapt to work practices, and to change preconceived notions and stereotypes about generations. This is something we really care about. The toolbox was the best occasion so far to state such a position and to make it the position of the Commission. And we think that the follow-up will be needed maybe in the next mandate. In this sense, we should develop a real sense of age equality, where opportunities do not depend on the age bracket, where people of every age can participate in public life and have their say, where everyone can access key goods and services. I'm just repeating maybe what has already been said, but still we also believe it. And where intergenerational solidarity, appropriately defined and applied to life situation, becomes a reality. In the toolbox, we commit to upgrade demography-related policies at all levels by mainstreaming demographic concerns in relevant Commission policy proposals. You may be aware, since you participate to the A-level group on non-discrimination, equality, and diversity, that the output paper is being published basically. Later this year, the Commission will also publish the Pension Adequacy Report and the Aging Report, with the first one with the Social Protection Committee, the other one with the Aging Working Group of the Economic Policy Committee of the Council, which will be accompanied, the second one, the Aging Report, will also be accompanied by a dedicated conference. But I would also mention the fact that an aging society needs investment. And here, once again, I've seen that it's already been mentioned, in adapted mobility and infrastructure solutions. Adapting the infrastructure can benefit the entire population, actually, not only older people, and can be carried out in a green and digital-friendly manner. There is plenty of room for innovation in this sector. With the European Accessibility Act, the EU makes products and services more accessible for older people and people with disabilities. But also infrastructure and public space should consider the impacts of the climate and environmental crisis for older generations. Because climate change and air pollution have detrimental impacts on the mortality and morbidity of the population, particularly affecting more vulnerable groups, including older people. But the main point is that we should change our mindsets and approach design and policies with this new way of thinking, where older people feature as main characters and where they can also be contributors, not only recipients of care and aid. We see the next 5 years as an opportunity to blossom. We have just laid the seeds in these 5 years. Citizens of all ages can potentially reap the fruits of our timely policy making. Now more than ever, we need you as our allies in delivering this vision for the future that tackles demographic change, leaving no one and nowhere behind. Thank you very much.
Thank you. Thank you very much for being the messenger of Vice President. As you said, we know each other now so well, and of course we don't know who will be our interlocutor on in the next Commission, both on the issues of equality, older persons. But we hope that Vice President Suica will hand over to whoever will take on this role, all those different ambitious plans. Certainly you can count on us as a stakeholder for sure in this discussion, but also an ally in promoting and progressing towards equality in old age. Actually, I think it makes sense to mention this because sometimes this question comes from persons who do not necessarily work on equality. Why are we speaking about rights in old age? Is it something separate, specific? Of course not. We as older persons, we do not claim any special rights. It is just a question of being treated to the same in the same way as anybody else in the society. We have all different dimensions, age, our faith, all this diversity that each of us individually has, and this is of course, and part of this is as well age, and that's what we are asking for, is actually to be treated exactly in the same way as anybody else, so that older people who actually bring so much to the society can do it in a way that they are empowered and treated equally. Now I will, because I think it makes, so again, thank you very much to both of you, to the Secretary of State. Again, you were as well the messenger. I think we can count here for the follow-up, as I said, with the following European presidencies. Again, thank you very much to Vice President, because I think that we have to move to the next panel once again. If you want to stay with us for a bit longer, please take your seats. And now I will actually hand over to the next panel. It will be Vice President of Age, Anthony De Giovanni, who will take on this role. And as I was saying in the introduction, we would like to now look at the state of play of what has been done so far. Therefore, this first panel, and I can see that already different guests are joining us on the podium, will actually, with this first panel, we will discuss actually the state of affairs on protection from discrimination at different levels, at national, European level, Council of Europe. Please come in. I'm already making the space for you. So this will be our first, I would say, interactive panel. We will have, I hope, some time for questions, interaction. Therefore, I can hand the microphone to our Vice President.
Thank you very much. Yes, thank you. So this is the first panel. The topic is age discrimination in Europe. Thank you very much. That was a healthy instruction. Safety first, as they say. So this is the first panel. It's age discrimination in Europe. Where are we? A very important question. Where are we now in this sector? I introduce myself. I'm Anthony De Giovanni, as has been said, Vice President of Age, and I'm also representing the Malta Council for Older Persons. And I will be obviously the moderator of this panel. Ensuring equal treatment in old age is not a new issue, as you know. Argentina had presented a declaration for old age rights for consideration of the UN General Assembly way back in 1948, just a few days before the adoption of the Universal Declaration of Human Rights. The Council of Europe adopted the first provision in the world on the rights of older persons through Article 23 on the social protection of the elderly, or rather of older persons. The EU included in its Charter of Fundamental Rights a specific provision on the rights of the elderly to live a life of dignity and independence and to participate in social and cultural life through Article 25. And yet, despite all these provisions, age discrimination remains rampant. Across the EU, age discrimination remains one of the most pervasive forms of unequal treatment, with over 45% of individuals believing that age discrimination is widespread in their own country. The reference is Eurobarometer on discrimination in the EU of 2023. Globally, 1 in 2 persons are ageist against older persons, and this can be indicated in the Global Report on Ageism of 2021. In this panel, we want to take stock of the existing systems of protection of our human rights in old age at the level of the United Nations, the Council of Europe, and the European Union, but also to discuss the reality of ageism and age discrimination that many older persons are facing today. To discuss this important topic, we have with us Madame Elena Conturi Tapiero, who is the acting regional representative in the United Nations Office of the High Commissioner for Human Rights, Regional Office for Europe. We have Professor Yves Nolan, President of the European Committee of Social Rights, and also Mr. Carlos Theodore Fontencuberta, Deputy Director, Equality and Non-Discrimination, DG Just, European Commission. And last but not least, we have Madame Karina Ekova, Coordinator at Alzheimer Bulgaria Association and Project Manager of the Smart Against Ageism project, which we will have the opportunity to see during the break. I suggest that we start by first zooming at the global level, giving first the floor to Madame Conturi Tapiero and then to wider Europe and Professor Nolan, before we zoom into the EU with Mr. Didier Fontencuberta and grassroots experiences of other persons with Ms. Ekova, if you agree. So please note that we have to keep very short, so the first intervention would be not more than 7 minutes, 8 at most. So, Madame Conturi Tapiero, the OHCHR has been at the forefront of identifying gaps in the protection of human rights for older persons. What is your appraisal of the current state of affairs and also opportunities to address these issues within the existing UN system?
Thank you very much. Good morning. Microphone. No? Good morning. Yeah, good morning. Let me start by thanking H Platform, a much valued partner of the United Nations and of the UN Human Rights Office, for creating the opportunity to discuss age equality and the rights of older persons in Europe. This is a much needed discussion. Older people are often not visible or even discussed. They're not at the table of decision makers. They're not at national level, they're not at EU level, they're not at the international level. And when they are, it is, as we've heard, as recipients of care or as a demographic group placing a financial burden on society. It's very rarely about human rights. The COVID-19 pandemic put the spotlight on the flaws in the protection of older persons. The impacts were devastating. Not only were they at significant higher risk of severe disease and death, age-based discrimination in decisions on access to life-saving healthcare and triage was blatant. So were the horrifying stories of older persons left behind in care homes among the dead bodies of their peers. While the pandemic is behind us, the promise to build back better rings rather hollow. What measures were taken to prevent such violations in future crises? What has been done since to promote and protect the rights of older persons? It's important to note that the pandemic merely amplified challenges that older persons already faced before. Lack of social protection, lack of access to health services, lack of autonomy and participation in decision-making, and risk of violence, abuse, and neglect. At the basis of these challenges lies ageism, which is so pervasive in societies that it goes largely unrecognized and unchallenged. Ageism results in older persons being perceived in a generalized way, built on assumptions and stereotypes. Ageist stereotypes includes portraying older persons as uniformly frail, dependent, and vulnerable. In reality, older persons represent the most heterogeneous and diverse segment of the global population. They are the most diverse of all age groups. Older persons frequently make irreplaceable contributions to their families, communities as workers, caregivers, volunteers, and community leaders. Yet older persons are overwhelmingly excluded from clinical studies or denied medication because of their age. For the same reason, their opinions, including on medical treatment, are often disregarded. Again, barriers prevent older persons from accessing the labor market. They are less likely to be taken seriously by law enforcement bodies, and there is evidence that social workers are less likely to label a case as abuse and offer help if the victim is older. As a result, a great majority of violations and abuses involving older persons are tolerated or suppressed. The protection of human rights of older persons is inadequate at all levels, including within the UN human rights system. This was highlighted in an OHCHR analytical study of 2012, updated in 2021, on the normative standards and obligations on the human rights of older persons. It shows that the existing human rights framework for older persons provides fragmented and inconsistent coverage of the human rights of older persons, both in law and in practice. The analysis conducted by the Office for Human Rights shows that to overcome these gaps and the fragmentation of the existing international framework, there is a need for a fundamental shift. For more than a decade, the Office for Human Rights has been advocating for a legally binding instrument dedicated to the human rights of older persons to close the protection gap. A dedicated instrument would not create new rights. It would concretize existing rights with regard to older persons. This would bring closer alignment among varying national legal and policy frameworks. I would like at this stage to salute the recent decision at the last session of the UN Open-Ended Working Group on Aging, and salute also the hard work of NGOs such as the Age Platform. Member states adopted by consensus a recommendation recognizing the need for an international legally binding instrument to address the gaps in the protection of older persons' rights. Here I would also highlight a recent landmark judgment by the European Court of Human Rights. An association of older women brought Switzerland to the court because their health is threatened by heat waves compounded by the climate crisis. They argued that their age and gender put them in a vulnerable situation. The ruling highlighted that the climate crisis is a human rights crisis and that climate inaction is a human rights violation. The women described their victory as a victory for all generations, and many of the arguments used were included in an analytical study prepared by the office in 2021 on the protection and promotion on the rights of older persons in the context of climate change. It's high time that it's recognized that older persons are holders of rights, active agents, empowered to claim their rights and contributing meaningful to society. The Summit of the Future in September provides another important opportunity to seal member states' global commitment to age equality and the rights of older persons, particularly through the Declaration on Future Generations, one of the key outcomes of the summit. And perhaps I will stop here just to say that future generations is the young people of today who will be older tomorrow, and that inequalities accumulated during the life cycle are made worse as the life cycle goes on. And we must keep reminding ourselves that we're all born free and equal. Thank you.
Thank you very much, Madam Consulita Piero, for starting off this discussion with a lot of information. Thank you very much. So we turn now to Professor Nolan. And I ask, what is the European Social Charter telling us about our human rights in old age? What does it offer in terms of the protection of older persons' rights that other European human rights standards, like those deriving from the European Convention of Human Rights or the EU, do not? How can we make the best use of the European Social Charter in our work towards age equality? Long question.
Long questions, and I'll tackle some of it now, but I'll also tackle it, I think, probably later on in conversation. Very quickly, before I begin, how many people in this room had heard of the European Social Charter before about 45 seconds ago? Fair enough. A reasonable show of hands. I feel I'm amongst familiar friends and also with less familiar friends. So what I'm going to do today, and I apologize for, I mean, nothing closes down a conversation like a detailed technical legal article, right? So that is in the background for information, but please don't bother giving it time or attention or reading. My job today as president of the European Committee of Social Rights, which is the body that monitors the European Social Charter, is to provide you with a very short overview of what we have done in relation to older persons' rights. And this is an important, I ask about the Charter, how many of you knew about the Charter, because in fact, the Charter suffers from a relatively low profile when compared to both the European Convention of Human Rights and of course, EU standards. But in fact, if you look at the scope of protection given by the Charter in explicit rights terms, focused on state obligations, state duties, it goes well beyond what we see in terms of what is provided either under the European Convention or under the EU Charter of Fundamental Rights. So if we're interested in older persons' rights in Europe, this is a very important standard for us to be aware of, okay? So I want to be clear, you can see, and we've already heard about and I like our colleague who spoke earlier, I very much welcomed the guidelines. But as you can see, 1996, the right of elderly persons to social protection. But I should be very clear that we as a committee have been using the language of older persons and have been very conscious of the problems with the wording of Article 23 in our work for a long period of time. So please do not feel completely switched off by the language used there. And I think what's important to flag in Article 23 is that it's very wide-ranging, okay? It's focused not just on a notion of maintenance of, of vulnerable older persons as passive recipients of social protection, okay? It is not focused on that. Rather, the Charter and the way in which the Charter has been interpreted by my committee has very much focused on enabling older persons to remain full members of society for as long as possible, enabling them to live empowering and resourcing them to live a decent life and play an active part in public, social and cultural life. It requires states to adopt measures to enable older persons to choose their lifestyle freely and to lead independent lives in their familiar surroundings for as long as they wish. Okay, active, inclusive social citizenship is at the heart of Article 23. I know that it is of huge concern and very much drives the work of others in this room, particularly those involved in age equality. Now, while we as a committee acknowledge the different forms of, vulnerability, faced by older persons in society, our key focus is on this social exclusion and social inclusion and equal active citizenship. Now, you may notice at the bottom of the provision, and you don't need to read it, I'll mention to you now, is that this provision does talk about institutionalization. Okay, in terms of requiring states to guarantee elderly persons living in institutions appropriate support while respecting their privacy and participation in decisions concerning living conditions in the institution. Okay, again, I point out this is a 1996 standard based on an 88 standard. We as a committee are in all areas of our work, including this area, in the area of older persons' rights, are extremely focused on pushing forward deinstitutionalization. And of course, COVID, as we've heard from Elena, as we've heard from the other speakers, has turbocharged this work. It has made absolutely clear how fundamentally important it is that states, as Article 23 requires, should take steps to move away from the institutionalization of older persons and adopt a long-term care and support in the community model. This requires states parties to make adequate provision for independent living, including housing suited to older persons' needs and state and health, as well as the necessary resources and supports needed to make independent living possible. Okay, so Article 23 gives us, in a European human rights law context, what we need to push forward the legal and policy changes that we want to see happen at the national level, and indeed, perhaps, for instance, in the context of EU law and policy making also. I want to also speak very briefly, because I know I'm coming to the end of my time, about the issues of ageism and discrimination, which of course underpin and reinforce the marginalized situation of many older people in European society. And concern about these is a huge part of our work. And obviously, equal treatment calls for an approach based on the equal recognition of the value of older persons' lives in all of the areas addressed by the Charter. And we take due account of contemporary definitions of ageism, which refer to the stereotypes, prejudices, and discrimination directed towards others or oneself based on age. Okay, so we're very much driven by this notion of ageism, understanding of ageism. But I should be clear, our work really in the last 5 years has focused on this, has focused on the issue of older persons. Before that, we did not give the area or the issue the attention it should have done. So I am here today not just to tell you about our wonderful but necessarily limited work, but to learn about the challenges and to learn about what we should be doing to push those standards forwards. And we have made clear that Article 23 requires states to have an adequate legal framework to combat age discrimination in a range of areas beyond employment, access to goods, facilities and services such as insurance and banking products, allocation of resources and facilities. And crucially, we, in our COVID statement, which was a statement highlighting how the Charter applied to the pandemic, we underlined very strongly the issue that Elena has already related to, the lack of equal treatment in medical care and support around the COVID pandemic that led to catastrophic loss of life, but also hugely undermined support and independent living for older persons. And we require states to adopt comprehensive legislation prohibiting discrimination on grounds of age explicitly, and that states must take a wide range of measures to combat ageism in society, including reviewing and amending legislation and policy, adopting action plans to ensure the equality of older persons, promoting positive attitudes towards aging through activities such as society-wide awareness campaigns, and promoting, crucially, intergenerational solidarity. Because I'm going to finish by piggybacking on Elena's comments about this linkage between, this very strong linkage between how we treat people throughout the first part of their lives and how that impacts on and leads and shapes their experience in the later part of their lives, and also feeds into how we treat those groups in the later part of their lives. Because intergenerational solidarity is absolutely fundamental in challenging this. We also have a lot of work around employment, in age discrimination in employment, but I'll leave it here for now. But thank you very much for listening, and I'm very happy to come back to it as we go on.
Thank you very much, Professor Nolan. I move directly now to Mr. de Fontaine-Comberta, and I will ask him what has the European Commission done so far to address age discrimination, and what do you see as opportunities and challenges in adequately addressing age discrimination under new legislature?
Thank you very much. Let me first thank Age Platform for organizing this meeting and for inviting the Commission to participate. It's always a pleasure to be with you. We have a long-standing cooperation, and it's very important for us to be here today. I would like to start by recalling maybe something which is very basic, but the European Union is founded on the basis of principles of the fundamental rights and the protection of protection of equality and fighting non-discrimination. This is something that we have to keep always in mind, and this is something that also drives our action at political level. While the European Union does not have, let's say, competencies in some of the areas on age, we have tried to fill the gaps by also providing support or political guidance, or ensuring best practices between the member states, or even trying to fund initiative for on the age area. Although we do not have this competency, we, as you know, and it's been already mentioned, there is of course, the Employment Equality Directive that includes also questions on non-discrimination on age. But even more important for us, as you know, and it has been also mentioned by at the opening, the European Commission adopted a proposal for the Equality Treatment Directive, which is still under discussion. I would like to take the opportunity here to, now that we have still Younes Kaddour-Jebbar, to thank the Belgian presidency for the support, because for the Commission this is still and keeps being one of the pivotal and a priority for us for that we are discussing, and well, we have still 15 days to go to close to end this presidency. But again, thank you very much for the support, because I think that we are not yet there. We did not have this yet an agreement. Much more has been done, and a lot of discussions have allowed us to progress on this area. So thank you for your presidency. As you all know, this commission, it's been the commission of the Union of Equality. This was at the heart of President von der Leyen Commission. And as you all know, we had the first ever equality commissioner with Commissioner Dalli, but also, as you heard before, the first ever democracy and demography commissioner. So I think that these are elements that it's worth mentioning about the importance that the commission, this commission that is going towards the end, at the end of this year, has put age, non-discrimination, equality in the political agenda. Of course, you all know that we have several strategies, LGBTIQ strategy, the Roma strategy, gender equality strategy, all of them on specific grounds of discrimination. We can always ask why not age, but please remember that all of them, they have an intersectionality element that we have at the Commission. We have ensure that the age is always an element, a central element in these strategies. You know perfectly that, for example, on the gender equality strategy, there are actions that are about the equality between men, older men and older women. So there is this intersectionality element that we wanted to put forward. There are not only in the area of equality itself that we have been working, as my colleague Marco Lamarca was mentioning, we have the toolbox, which has been a very important element to address also issues of a society that is aging, not only on the ideas of health or pensions, but really with the idea of how older people can participate actively in the economy, which is something that, as he was mentioning, it's something we need to reflect further. The tool, it's a very useful system for the member states to decide how they want to improve their own different policies in this area. But again, it's not only equality. There are many other actions, like, for example, programs on health for Europe, that is with which 75 million euros is trying to also cover activities in this area, but other elements in the health policies that the European Union is adopting as well, covering that. Of course, an important mention about the international dimension, and here I think that H platform has had a very relevant participation in all the discussions on the United Nations. The European Commission, with the member states, they have also participate and try to share the same views that more is needed. And we have been following closely what happened in May in New York. We will continue this international dimension because we really believe that more is needed at international level. Let me go to the end, I see, but I want to really remind and underline the role of the member states. We are working with them at within the high-level group on equality and non-discrimination. We are meeting them regularly, and in June last year they decided to focus their activities also on age. So we are very pleased that this is happening. Discussions are progressing very well, and we hope that an outcome will be soon issued out of these discussions. Just really the final word to say that we at the European Commission, we are also funding activities through the SERF program, Citizens Equality Rights and Values program. And we are funding Age Platform activities because we believe that it's important that civil society is actively working and actively participating in the political debates that we have. And just to underline the role of the civil society organizations such as Age Platform, which should be allies for the future. Thank you very much for this. Thanks.
Thank you very much, Mr. Dede Fontaine-Umberta, for this succinct overview. So I turn on now to Ms. Ekova. And this is my question for you. You have been involved in a European project that has surfaced different forms of discrimination against older persons. What can we learn from this project about the realities of older persons, and how can we work to best address inequalities in old age?
Thank you so much for this wonderful opportunity to present our project Smart Against Ageism here at this amazing conference. So it all started 2 years ago in a consortium of 7 partner organizations all over Europe. And it is an Erasmus Plus project, which aims at, on the one hand, raising awareness on the problem of ageism, but on the other hand, to educate people on how to be more tolerant and empathic in society. So we did that by developing 4 educational materials. We developed a compendium responding to ageism, which includes introduction to the topic of ageism, but also provides valuable real-life situations of ageism and the consequences of it. Then we developed an interactive game, which includes these experiences and provides an educational opportunity in a playful way. And we also have a toolkit for trainers, which consists of different activities for trainers on how to address the topic of ageism and how to give information to the trainees. And last, we have the policy recommendations, which include good practices all over Europe about ageism and how to tackle it. And they are aimed at policymakers, non-governmental organizations, as well as grassroots organizations. So the valuable thing about this project is that we not only conducted desk research, but also we interviewed people from the target group, and they shared their experiences regarding ageism. The interesting thing is that they didn't even realize that they were facing this problem. Ageism is so internalized that when we were asking them different questions, at first they didn't say that they are experiencing ageism, but when we asked them specific questions, it turned out that it's actually ageism that they're facing. Moreover, within society, the ageism is normalized, and in all the interviews and desk research, we found that actually society doesn't even realize that there is this thing about ageism. And this is important because research shows that on average, people live 7.5 years less due to ageist practices. So within this desk research and interviews, we also identified 5 important areas of ageism, which are the work, health, social, construction, and advocacy sector. Within the work sector, probably most of you know, but there are less training opportunities for older people, as well as less opportunities for promotion and recruitment. In the social sector, people have limited access to participation in the social life. They're usually devaluated of their own contributions to society. and the behavior towards them is condescending. In the health area, people usually don't receive equal opportunities for examination and medical treatment. And in the construction area, although this is a problem that is general, but most of the construction buildings are aimed at the normative of a healthy adult, and they are not easily accessible for all all groups in society. Then last, we have the advocacy area. We included it because we believe that it is important when people experience this type of situations that they should report it. In most countries, there is an anti-discrimination office. So older adults should feel that their rights are respected and their voices are heard. And within the policy recommendations, we actually conclude with 5 or 6 main ideas on how to improve the situation. First of all, we should think of ageism as a human rights problem, which is we need to feel that older people are right bearers and they should feel empowered. Another thing is that we need to have a combined approach. So this means that there must be integrated policies within the different sectors of society and the mutual works between not only policymakers, but also different institutions, NGOs, and grassroots organizations. Of course, raising awareness campaigns and promotion of active aging is very important. And last but not least, the political commitment and funding is also very important. And to conclude, I would like to invite all of you during the break, which is coming very shortly, to try out our interactive game to check whether you have these ageist practices and to learn more on how to tackle this problem and how to educate people on ageism. Thank you.
Thank you very much. So we have a couple of minutes maybe that in which you would like to react to whatever we've heard, maybe, or as we go to the audience for questions and comments as you wish. Yeah? Right. Okay, so the floor is yours now. It's open for discussion. So make a sign, identify yourself, and make your short comment or question.
Hello, thank you to the panel for all of that. My name is Alison Bow. I'm representing Active Retirement Ireland. My question is open to any members of the panel, and it is to do with moving towards equality when we are so fixed in a medical model of aging in many European countries. For more than a decade in Ireland, we've been campaigning for an independent commissioner for aging and older people who will sit outside of the political body and represent issues affecting older people. And we've not been successful in having an independent commissioner appointed. So the issues affecting older people become political and budgetary footballs every year, including pensions, housing and health. In Ireland and many other European countries, the ministers with a remit for ageing fall under the Department of Health or within the health section of the government. So my question is, how are we going to move towards true equality when our governments are so fixed in a medical model of aging? And we would say that aging is not synonymous with ill health and care. So how do we move away in a governmental framework from the medical model of aging?
Thank you very much for that very pertinent question. Now I move over to another question over here. Yeah.
Thank you very much. My name is Philip Hambro-Dots. I'm coming from seniors organizations in Finland. My question is to who in the panel would like to comment on it. We are talking about the situation of ageism and discrimination in Europe. Is this matter, aging, equality, at all addressed in education? That is to say, at what level, basic education or at high university level as a topic? Of course, we understand that there are differences in different countries, but if you have any ideas or view about this, because in my opinion, understanding ageism and ageism as young as possible is very important for the future. Thank you much.
We'll take a third question. Yes.
Yes. Hello. I don't have a question, but I'm dealing with the online participants, and there are two questions which popped up during the presentation of Professor Nolan, but maybe it's also to all of them. One is whether there's any recommendations on how to make labor markets more inclusive to older workers, and whether there's examples of welfare states which have flexible transitions into retirement in terms of the transition between retirement and labor markets and the rights of older workers to work and to receive a pension.
Okay, so I think those are enough food for thought for us to discuss. So there's been the medical model and the possibility of an independent commissioner, ageism in education, what can we do in the educational system, and also access to the labor market and flexible pension schemes, whatever. Okay, so the floor is yours. Yes.
Thank you very much. I'm happy to take the first two questions. So the issue of the medical model for aging, which is similar to the medical model for persons with disabilities. And we have seen that the Convention on the Rights of Persons with Disabilities, with its focus on independent living and getting away from the medical model of assessing disability, but looking at the needs of persons with disability in a holistic way, has brought changes. I mean, it's still not perfect, but at least we have a normative instrument which is very clear on what independent living means and what is autonomy and the right to participate in decision-making for persons with disabilities. So I would suggest that this is a good example to get inspired from. The second question about ageism addressed in education, I think it's very important and is part of what we advocate on human rights education. It's something that is missing from school curricula, especially in Europe. And I would submit that education, teaching non-discrimination on all grounds for children is vital. So age, race, ethnicity, sex, belief, origin, and it's something that we need to nurture at a young age, including through games such as the one mentioned by my colleague. Thank you.
Thanks very much for those questions. Very quickly, with regards to the very specific and very welcome questions online with regards to rendering labour markets more accessible and flexible transition into pensions, I would have to go back and I would have to check our jurisprudence. Sorry, by that I mean the work that we have done around those areas. We have certainly evaluated states' conformity with their duties under Article 23 against the backdrop of different, obviously, pension arrangements and also varying levels of accessibility of labour markets. But in order to provide, good examples, I'd have to go back and check. I'm very happy to do that. And if the person in question wants to follow up with me by email, they'd be very welcome to, or else I can feedback after the break. In relation to the first question, with regards to the medical model, with regards to age, I'd echo what Elena has said about the potential of or the learning that is offered by the experience of disabled people in the context of the right to independent living. I think also that there is, and I'm obviously aware of the Irish context, there's also lessons to be learned, I think, not to suggest that the position of the groups or the challenges they face are identical from the work that has been done around ensuring that children receive, as a social group, receive adequate attention, and the kind of transformative cultural shift and work that's been done around that in relation to the notion of active citizenship, children as contributors to society, not merely objects of protection. I think the work that's been done to bring around that cultural shift in a number of European countries, much work remains to be done, but there is definitely lessons there with regards to older persons advocacy. I do understand and I appreciate the sensitivities around, the language that's been used historically around older person, child life, blah, 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 which is both problematic for older persons, but also problematic for children in terms that it reflects prejudice and, stigmatizing conceptions of those groups. But I do think it's very important, if you see the work that's being done to mainstream children and their rights and their obligations into law and policy in different European countries, moving beyond medical models, or in the case of children, protection models. I think there's learning there that might be useful. With regards to education, I work in a university. In many, as part of law degrees, in many countries, students are not required to take labour law, which is where age discrimination is dealt with first and foremost, and where age discrimination is, or equality law, they're often optional modules, and where they're taught, generally the focus will be on gender discrimination or gender inequality or other areas, or racial discrimination. And in fact, I think there is a huge need to recalibrate university curricula around equality, labour, but also much more broadly to engage with issues of ageism, because of course human rights education in school is important in terms of shaping, attitudes towards older persons. But in fact, if we're thinking about older persons' interests and needs as rights related and something that can and should be pushed by the lawyers that do that work, then we need to be teaching lawyers about them. So I'd add to what Elena has said, kind of as a complementary or an additional layer of what needs to be done.
Yeah, thank you. I would like to come back to the question of the education you mentioned. Of course, you were talking more about how to how the young generations can be more aware of age and discrimination. But I would like to recall again that the even the proposal, the Commission's proposal on this Equality Treatment Directive, that also should cover education, enlarge the non-discrimination part. It's not yet adopted. So the debate is there, exists, not only within the dimension of the education by itself, but already the question of the non-discrimination on the grounds of age and other grounds, of course, but in terms of extending the protection to education. So and that's what I was referring to, the work that the Belgian presidency has been doing, which is it's remarkable to ensure that we have an outcome, a positive outcome. Probably, within the 15 days that we have, it may be still difficult, but we understand that the next presidency, the Hungarian presidency, has already mentioned that they would take over the file, which is always very important for us. Regarding the labor market, again, I would like to recall what the member of the cabinet of the vice president mentioned, no, about the question of the compulsory age of retirement. There is a need maybe of reflecting about this. I think that as he was saying, the toolbox, the initiative that have been taken by the vice president, I mean, there are important elements for the political debate, and probably there will be drivers in the future commission. We'll see. We have just finished the elections. We will see whether we will have a new commissioner for equality, or maybe demography and democracy. We will see how age is also placed in this debate. It's very important to see in the following month how the discussions between different political parties, the member states, will end, and setting up a new commission with a new parliament. Thank you.
I'd just like to add something about the education question, because our project was aimed at educating people. So all we know, what we found during our research, was that there is insufficient education opportunities regarding ageism. What is more, the notion of ageism is not clear, because people usually mistaken it with positive ageism, but this is still ageism. So many things need to be cleared out, and opportunities need to be provided not only by educational institutions, but also by organizations. So in this field, there is a lot of work to be done yet.
Thank you very much. We have time for a couple of more questions or comments. Yes.
Good morning. My name is Claude Varret. I'm the treasurer of Age Platform Europe. I think that a key issue is the way we look at the older people. It is cultural. My suggestion is to run an advertising campaign showing the added value that older people are producing for everybody. What do you think?
Yes. Yes, please.
Good morning. My name is Pamela Suero. I am a PhD researcher working with the Homage Network and the VUB in Belgium, and also working with the Age Platform, collaborating on my segment. My question is for Ms. Elena. She referred the Summit of the Future as an important initiative where we could bring in the issues of the human rights of older persons. But we heard at the opening the working group that aging has been absent from the documents of the Summit of the Future. It's very surprising, right? Because the future, it's about aging, right? And so how do you think we could then work towards bringing in these issues and ensuring that that aging with rights is it's clear in these documents and is in this declaration of future generations? Thank you.
Hi, I'm Nena Yoranzi from Age Platform Europe. Professor Nolan, you mentioned that we should not be put off by some of the language used in the European Social Charter, including the term elderly. But one troubling language for me is this reference to as far as possible that is included both in the European Social Charter, in several UN instruments. We currently don't have a specific instrument or action plan at EU level, but we have seen it also being reiterated in the Green Paper on Aging. And this is the only group in society for which we have that language. And this is really problematic when we try to apply the rights of older people in practice. And Mr. von Guberta, you also mentioned the issue of intersectionality. So this impacts the way that we can apply equal treatment in old age. Because again, what we have seen, for example, is that the Green Paper on Aging talks about older people's rights to live in the community for as long as possible, whereas the disability strategy talks about the right to live in the community on an equal basis with others. And this has really practical implications on the ground, where we see age limits in access to disability benefits, to mobility allowances, for instance. In other areas, it might be age limits in, in access to prevention or surgical treatment and so on. So the reality is that this language has, even though I know that the efforts of the committee is to interpret it in different ways, but from a very societal, symbolic perspective of what laws should be inspiring us to look up to and to aspire to, it's very limiting. It's still very biased and conceptually limited. So how can we move away from that? I understand that revising text is really, really complicated, but that's why for us it's really important to move forward also towards adopting new instruments such as an age equality strategy and a UN convention. But is there anything else in this picture that we're missing and we need to be doing to overcome those biases that exist in the law? Thank you.
Thank you very much. So we have awareness campaigns, Summit for the Future, and terminology.
Thank you very much for the question on the Summit for the Future. In fact, the issue of language and what we include or do not include in outcome documents is it's also a discussion we have internally, because if we insert, say we insert language such as we want human rights to be referred in the document, or we want ageism to be referred in the document, of course, we make the proposal and then the word is stricken out and then the issue is removed. So what we are advocating for is that, the issue of ageism or age discrimination be taken care of in an intersectional approach. And if the issue is about non-discrimination, including on grounds such as age, and the intergenerational element looks at the whole age cycle, then it's one way where the rights can be mainstreamed throughout the document. And it's a view that it will face less risks of, the specific language being taken out. So this is a challenge we are facing, and this is the way we are trying to address it. The other point I wanted to make is that there are other ways to bring the issue of age discrimination to the to UN fora and to outcome documents, including in the Summit for the Future. For example, we have at the office, we're advocating for this concept of a human rights economy, which means that you need to look at economic and policy decisions through the lens of human rights and see to what extent these policies discriminate or favor specific groups, and to what extent they value the contribution of older people. So yeah, this is what I would advocate for, an approach that is more mainstreamed and includes the rights of older people in all policies. Thank you.
Thank you so much for that, Elena. And just, I suppose, to add to that, that as someone who does a lot of work around intergenerational equity and future generations, a declaration on future generations that purports to be about rights but doesn't use the language of rights is of extremely limited value to those making rights arguments. I know you know this, but I simply want to flag in a way that perhaps Elena can't, the importance of advocating around this so that there's external pressure placed on states that do not wish to see references to human rights, whether of future generations or other groups within the document. Forgive me for piggybacking in that way. the excellent point about as far as possible, Nena, every single human rights treaty is a product of its time and of compromise. And if you were doing that treaty now and you were writing it as far as possible, first of all, our understanding of what is possible has massively changed. We have greater awareness of that. I doubt very much the language would be in there, right? I fully appreciate it is in there. It is a potential barrier. What I would say is that there's awareness that this is an outdated, problematic concept. And like any other, for instance, with us doing our work, but the UN treaty bodies are the same. These are living instruments. We interpret them in line with best practice and understanding of the rights challenges faced by the groups that we're thinking of. So we aren't going to use the language of as far as possible or allow states to argue that this limits their duties that they owe older persons. So I understand the concern and the potential conceptual challenge there when it comes to older persons' rights. What I would say is in practice, that isn't what's going to happen because there's understanding of that. And I'm speaking from my own committee here, but I would be, I would hope that UN treaty bodies, when the same argument is made to them, would be receptive, while completely agreeing with you that if we're moving towards a global instrument, which I hope we are, it is absolutely fundamental that we avoid language like that could be seized on in a more modern instrument as suggesting that states' obligations are limited and based on these ageist, outdated views of older persons. So just to respond to that, I'm trying to remember. And the advertising campaign sounds fabulous, but I have no views on it or expertise, so I'll pass over to my two colleagues who I suspect do.
Thank you. Yes, on the campaign, I think that awareness and communication is always very important. I'm not sure that whether how this is effective in the end. That it depends on the campaign. I just recall that the European Commission issued a very nice campaign for these elections, where older people were explaining their experiences in the past and were pledging for young people to vote. And also older people to vote. I'm not sure that this was seen by many people. Probably communications are today are so it's a changing world, and it's very different from before with all these social networks and so on. But indeed, I mean, it's always good to think about that. On the comments about the words that we are using, and it's been mentioned. Well, there was the reference to the strategies, and I would like to just to remind that these strategies, are not legal binding documents. Legal binding documents would be the adoption of this directive that we are putting as a priority for the Commission in our area, in the area of equality. So, yeah, indeed, we will surely assess and review the impact of these strategies, because some of them will end in 2025, and we will see what we need to, which will be the lessons learned, what we need to change, what we need to address, what has worked, and what we should reinforce. But again, these are strategies. The member states are responsible according to the competencies in the European Union of many of the areas that you were mentioning. So yeah, we can still work with them. We can encourage them to do things to promote best practices, to have political guidelines, to fund projects, but there is a limitation in what we can do. Thank you.
Regarding the first question about the campaigns, I could say that there are actually different campaigns regarding ageism, and the good thing about them is that they show the views of older people themselves. For example, Age Platform has this initiative, Eco Aging, where on the internet people post experiences on ageism. There is also a German campaign, which is a institutional campaign. And again, the idea is the same, that the image of other people can be positive, and we need to show that through images of different situations of other people. Thank you.
Thank you. Thank you very much. Now I have a question myself. So, would you like to make a comment, but very short, please, because we're running out of time.
So just specifically on that, for example, Austria also had a campaign on older workers, where older workers are specifically stating what their contributions, positive contributions can be. So maybe this is also something we can share with the members for inspiration.
Thank you very much for that. One final question and your conclusions as well, please, very short. So how can all these levels, the United Nations, the Council of Europe, the European Union, and the national and local work together to promote age equality? What do you see as important gaps and opportunities that the next European Union mandate needs to take into account? So we start with you again.
Thank you very much. So we all need to work in synergy. We're at a time, and we've heard it, where we're facing very serious pushback against human rights. And therefore, we need to work in concert. We were speaking with IFA just before the panel that, you know, the two committees, the UN committee and the committee of the Council of Europe, they need to speak to each other. They need to strategize. They need to push the envelope. Seeing SIRPA, the Fundamental Rights Agency, has also issued a very valuable report on the rights of older persons in the digital sphere and in accessing social services. So we really need to work together to put forward the issues that need to be resolved. Thank you.
It's an excellent question. I think that giving a particular EU focus, I think it's very important that it's very striking. I think that, for instance, Article 25 of the EU Charter on Fundamental Rights on Older Persons was directly inspired, though it's a much more narrower standard than Article 23 of the Social Charter. And I think there's a need for much more intensive conversation around older persons' rights and ageism between whether the committee or the Social Rights Department, which is our supporting secretariat, and the relevant parts of the EU working in this area. We're obviously very open to that, but I think it's very important, if we're serious about putting together a Europe-wide, particularly an EU-wide strategy that is rights and human dignity centered. So I think that there's great opportunities for collaboration there, and for also, you know, the huge learning that, for instance, our committee can take, drawing on the information and the expertise of colleagues working on the ground, both at the national level and at the EU level. So I think push the conversation forward and make sure that efforts are mutually reinforcing and not undermining, which I think occasionally they can be if different actors working in the same space don't talk to each other.
Thank you very much. No, indeed, I would like to underline what you just said, the idea of working together. I would like to give an example that on the convention that the Council of Europe has just adopted, and I think it was in May, on artificial intelligence and non-discrimination. The Commission has been working closely with the Council, and we will continue working closely with the Council for the recommendation. And these are I think that it's important to say that there are elements that we can still continue strengthening, and this is clearly one of those. As for the future and what we can do, I think that we have done quite many activities. Probably we will need, as I was saying, to assess how they have been implemented, which were the good part of it, or what we need to reinforce or to correct. We are here an opportunity with the new commission. We will see who is the new commissioner on equality. If there is one commissioner, we hope so, on equality. What will be the role of the parliament here? It's important also to keep always in mind that in the end, the political parties and that they define the policies that needs to be implemented. But there are some seeds, as we heard this morning, that have been laid, at least from the commission side. And I think that we need to see how all this information can inform the future political decisions of the commission. Thank you.
Thank you. Well, I also believe that an integrated approach, which includes, which is at vertical and horizontal level, is needed. Of course, funding from different strategies and ideas should be implemented as well, because otherwise it's just things that are good to be done, but we need to work on actually implementing it. So yeah, I believe that an open dialogue is needed and that we need to deepen it, as the others already suggested. Thank you.
I must say I'm overwhelmed with the wealth of information that has been given by the panel, and I ask for a round of applause. Well, succinctly, there has been a stock taking of what has happened. However, also was highlighted how much more work needs to be done in all these fields. I thank you also for your contribution to the discussion, and I must advertise now the exhibition there and also a much needed coffee break. Thank you for your attention.
Thank you. We need to be back at 11:30 after the coffee break, so please be back at 11:30. Thank you.
You should.
And I feel it's going to be an experience.
Yeah.
Well, I don't do that. And I would, I mean, if it's, it has to be, would be really, you know, just have a conversation where we can, and maybe there, you know, something. It doesn't have to. It doesn't have to be anything very sort of. And then next, yeah. And for us, meeting a a lot of the time. So these are two comments that I'm doing.
Thank you.
Great meeting you.
It was a pleasure.
Getting up to speed even beyond your I do it to the car. I will get an email from, but I get an email from me.
I always forget them at home.
Exactly. Well, oh, that's great. No, so we've got you while you're fresh. Where did you move from? Where did you come from? Oh my goodness. Wow. Big change. Amazing. Wow. Oh my God, it's a big. Yeah. Just do everything the social charter does. Really. Yeah, exactly. A provocative. It's very good to meet you. I hope I see it.
No, but I hope I wasn't too pessimistic. But it's very, very difficult. I mean, even for my human rights, huh? I thought that I can now.
Ja, ja. Precies. Alleen stil.
I think you must have seen the work with the inheritance.
Yes.
Summarily, you
Hi, Mary, and then, thanks for coming.
only that's made, it's done. But maybe that's
I'm here. And here, I'm running around.
C'est bon, on peut les laisser. On laisse 4?
We met, we already have the same.
You sit it here? Okay. I'll choose this one. No.
If you need to, we have, you have
Thank you. In English, just in case there's a French question that I don't understand. Okay.
On the phone.
Hi, Mary.
Hello, how are you?
From the European Disability
Lovely
Forum.
to meet you.
Nice to meet you too. I think so. So you were mostly with Marie,
Exactly.
Pirko,
Marie, Pirko,
yeah,
exactly.
and Catherine.
Catherine. And yes, I've been meeting Catherine today as well.
Yeah.
She's in New York now.
Yeah.
Great. Before, you went.
Yes, the Conference of State Parties to the CRPD. And they have elected for the first time.
I'm putting it here, just because
Thank you.
when you leave the room, because do not, like, ask someone just to remove the.
Okay. I hope I remember. Or maybe I.
Or you can put it here, it would be easier.
So what languages would that be just in French?
Yeah.
If you want, the channel for English is two.
Just the two languages. Where should I sit?
Yeah, French and English.
Where should I sit? Over there? Or do you have a preference? No, I don't. Whatever you choose. I don't really. Okay. I would try to. So, hi, nice to meet you. That's you have you have mics here. Yeah, we have two mics. I think. Turning my back. Welcome back to the room.
Maybe we can. Hi.
I just switch it on. We take something and
Yeah.
don't disappear without falling.
Yeah.
Welcome back to the room. In the previous panel, we spoke, we heard a lot about the fundamental rights and European documents and strategies. And I wanted to start with, this thinking about what justice is. And justice is not just about making the right way to distribute things. Justice is also much about having the right way of value things. And as the European Union has a fundamental value, equality, In this panel, we'll continue the conversation about equality and different people and different ages. My name is Maria Petkova. I used to be connected with age years ago. Then I did other things. And about a year ago, I came back to age, this time in my identity of an older woman. And I'm saying this because then I can feel the difference, when you're working for older people and when you're one of them. And I'm saying this because, we're talking about aging. And when we talk about aging as age, we mean older people. But let me remind you that younger people are also faced with aging attitudes. And I will tell you in a very short list, it's not a story, but it's quote a friend of mine. He used to say, up to a few years ago, people used to tell me, you're too young to have an opinion. You're too young to decide. You're too young to understand things. And now they tell me, well, you're too old. You don't understand this world. Things have changed. So what happened? In this panel, we have a few really interesting panelists. And these are people who have experience on a European level as well in dealing with specific grounds for discrimination. We have with us Alexandro Moledo, who is head of policy and deputy director of the European Disability Forum. You're welcome. We have Mary Collins, who is secretary general of the European Women's Lobby. Good to have you with us. And Ida Yancey from Euro and Central Asian lesbian community. You're very welcome. I'm going to start with a question for the three of you, and you're more than welcome to give us your perspective, your impression, your challenges. And let me start with asking, how do you see, how did you share with us the EU equality framework and how these address inequalities in terms of in the fields of women, people with disabilities, and LGBTIQ people?
Well, first of all, many thanks to AIDS Platform Europe for inviting us to your conference. Very glad to be here. Yes, my name is Alejandro Moledo. I work for the European Disability Forum, which is very similar to AIDS, representing and bringing together the European disability movement. So different organizations representing the different disability groups, and also organizations at national level representing the disability community. Well, in the past 5 years, we've seen, I would say, an improvement in the Commission's approach to equality. It was already mentioned before that for the first time, we have a European Commissioner with the responsibility for equality policies, Commissioner for Equality, who actually had in her mission letter the specific request to implement the UN Convention on the Rights of Persons with Disabilities, which, as you know, has been ratified by all member states of the EU, but also by the EU itself as a supranational organization for the first time. So having that leadership in the Commission's College of Commissioner has been definitely a very good step forward that encourages us to work closely with her and with the services in the Commission to advance on equality policies for persons with disabilities as well. When we started this mandate that now comes to an end back in 2019, we didn't know whether the European Commission would actually adopt a European strategy for the rights of persons with disabilities. We had previously the European Disability Strategy from 2010 to 2020, but after that it was unknown whether the Commission would prepare a new strategy in light of the final, ratification of all member states and the EU of the CRPD. So having this leadership in the Commission helped us to push this agenda forward. And I must say that for the first time, we noticed that the Commission did make a very big effort in consulting with organizations representing persons with disabilities. So they run not only consultations, but also workshops and meetings with us to shape the strategy that finally they released in 21. So we have the disability strategy from 2021 to 2030. Having a strategy, even a strategy is a strategy, but the good thing, and for us it was very important to have it because it's a document, it's a roadmap that outlines the vision of the Commission and how to implement disability policies. And in that regard, we were happy to see that many of our proposals were also kind of reflected in the flagship initiatives and in the actions that the Commission laid down in this document, which obviously is not a binding document, it's not hard legislation, but the Commission is accountable for it. And the Commission, if they commit to deliver a specific action by this specific year, they are intended that they are foreseen to do so. So for an advocacy organization like us, was very important to work with the European Parliament, with all our members and with the Commission to push this agenda forward and having these actions that now have resulted in some important advancements or kind of ideas that now come to a reality in this past legislature. So we have, for example, the European Disability Card, which has been a long-standing demand of persons with disabilities, like a card that could ensure mutual recognition of disability when you travel across the European Union, or a European Center for Accessibility, because accessibility is quite a technical issue. And now we see that there is a huge European funded project, Accessible EU, that helps member states, industries, disability community, older people's organizations to advance on accessibility in built environment, in technologies, in transport, etc. So we've seen these kind of actions coming into play. Obviously, we would have liked to see more legislative action, not so much soft measures, but indeed, it was a positive improvement, which was complemented by, and I think we will talk this in the next in this panel discussion about ensuring this kind of intersectional approach. We will get into that, but it was also complemented by some legislative actions which are also important for equality. We already mentioned the Equal Treatment Directive that is still pending since 2008. But we have the directives on minimum standards for equality bodies, which are very important entities at national level to defend non-discrimination. So there has been progress, and I believe that the cooperation and the advocacy of civil society organizations has been crucial to advance on this equality agenda by the EU. And now we will need to fight again and to advocate again, because as it was mentioned before, it is unclear or is not set on stone that the Commission will appoint a new commissioner for equality. But I guess we will get into that later on.
Okay, good morning, good afternoon, everybody. And on behalf of the European Women's Lobby, I would like to thank you very much for this invitation. I also think it's very timely, your event, as we enter into a dark period. I think the results of the European elections and national elections have given a very clear signal of where we're all going. And we all know that the far right, extreme right, has nobody's interest at heart. And therefore, I think it's going to be challenging. But we should also perhaps see it as an opportunity for us to stick together, to work together, to develop our cooperation, and to really stand up for our rights, and to, in the words of Simone de Beauvoir, to remain vigilant, because we have to remain vigilant all our lives. But we know now, and I think we can certainly have a strategy together. And as the European Women's Lobby, we're willing to go down that path with you. We look forward to that. So equality between women and men has always been a mission, a vision, and an objective of the European Union since day one. So it remains so today, very much anchored in the treaties. And also since over the years, the concept of gender mainstreaming, although it's not mentioned as such, but the fact that every single policy should have a gender perspective, should have a perspective in relation to equality between women and men. That's what we call gender mainstreaming. So that is certainly ongoing and is something that we are constantly pushing for. So it means stepping out of the discrimination, I won't say box, but really to make sure that there's a gender dimension in every single policy, whether that's finance, whether it's transport, whether it's agriculture, etc., all of the competences of the EU. So we believe that to echo what my colleague said, the last period and the last mandate has been good. I think we can, clearly say together that we have seen progress. The mandate, which isn't quite finished yet, but obviously there won't be very much more happening in the next couple of months. But we believe as well that women's leadership does make a difference. We saw in the institutional mechanisms, the European Commission, first time in the history of the EU, that the European Commission was a woman, and her leadership did count. Everything she promised in her political guidelines, actually she did. And so therefore we're very pleased that there has been a lot of progress over the time. Also in the European Parliament, we had a woman president as well, in the European Central Bank, etc. So, and also gender parity in the Commission, where there was almost 50-50, not quite, but almost. That too makes a difference. It makes healthy decision-making processes, and it really mirrors the reality of all of our lives in Europe. But obviously, having said that we didn't get every single thing we wanted. And while there were many, good initiatives, there are many challenges that still remain. And one thing I just want to point out is that women are over 50% of the population. And you probably think, oh, we know that. But I think it's always good to be reminded of it. And while they live longer, their quality of years life is shorter. And therefore, what we see is that as women age, they become invisible. And if we look at the policies, and I'll give you a concrete example, in terms of violence against women. So we have the data and the statistics we have, which are still partial, but nevertheless, we have some. They stop at the age of 65. What does that mean? The women are no longer subjected to male violence after the age of 65. So that's something, and yet we know that 1 woman in 3 has been exposed to either physical, psychological, sexual violence since the age of 15 up to 65. So it's just, these are the kind of examples where we see that women completely become invisible as they age. And yet we should be celebrating the fact that we are aging. And it is, we're lucky that we can age, and that we have also, health systems, while they can be, to a certain degree criticized in terms of maybe the way they're managed, but we have health systems and we have made lots of progress in the medical field. So we're very lucky, we're all lucky to actually be aging. So we should be really embracing that and not making it a taboo or making older women and men disappear, but particularly women. Also in terms of statistics for employment, it shows very clearly that after the age of 65, you don't count anymore. And despite the fact that there's lots of pressure in every country to increase working age. So statistics haven't adapted to that either. And then obviously the issue that was on the table at last, I would say, over the last couple of years is pensions. There is a massive gender pension gap in Europe, on average between 30 and 40%. And you probably say, oh, that's a big difference, but it depends on how you count and what you count. if you're counting all of the pillars, or if you're only looking at, say, first pillar, which is the state pension. But if you bring them all together, actually there's a massive, massive gender pension gap. What does that say? That says that pensions mirror women's lives. They are the mirror. They are excessively over half of the gender pension gap, or pay gap. Pay gap is around 15, 13, 14. Again, the figures can be disputed, but nevertheless, the pension gap is over half, more than half of that, or more than double that, I should say. So this, what does this tell us? This tells us that they were expected to care primarily for everybody in their lives, from children to everybody else, stepped in and out of the labor market, and they are punished at the end of their working life because the pensions are appalling. What does that mean as well? It means women, as they age, are on a path to what we would call the feminization of poverty. And therefore, these are issues that really have to be tackled. They've been put on the agenda in different countries over the last couple of years as a patch-up system, but we really need to go beyond that, and we really need to look at more the structural issues. We need to have, the European Women's Lobby is calling for a care deal for Europe, which looks at care throughout the life cycle and gives both women and men the possibility to step in, step out of the labor market at different stages of their lives without being punished at the end. And therefore, we feel that maybe the directive on work-life balance will bring, hopefully, a generational shift where we will be going from a male breadwinner model to an equal earner, equal carer model. But we still have probably a generation to wait before that. So these are the kind of issues that we really need to tackle because they impact primarily on older women, and particularly women over the age of 65. Just then very quickly to say health. In the area of health, as I say, we don't deny at all that there's been lots and lots of progress. But again, the testing and the trials for medication and that are usually on the basis of the male body. And therefore, once again, symptoms, say, like heart attacks, are very different in women, and they go undetected because nobody thought that women actually experience these things differently to men. And also, while we're happy to see that there's a lot of discussion as well on period poverty, which has come to the forefront as well in many countries, we do not talk about menopause. It's like it's a taboo. And it really is something that we need to also embrace. It is part of aging, but it's something that we really need to give more political priority to as well. And then finally, I'll just say, and obviously mental health, loneliness, which also affects men, but loneliness and isolation. These are really the issues that we also need to tackle. And then finally, I'll just say we're in a changing world, as we all know, and I would say we're in a digital revolution. I don't think the word transition is good enough because it's as disruptive as the Industrial Revolution was back then, when people had to leave the countryside, move into the cities, work in factories. We are now being taken out of a real world into a virtual world. And that has many, many challenges in terms of I would say there's a generational and a gender divide. But also what we have seen is a massive explosion of violence, online violence against women. Again, we don't have enough data or surveys to see what age groups are being impacted. What we do see, women standing for elections just now, whether it's local, regional, national, European, or women, human rights defenders, feminists, etc., they are being systematically attacked as a process of really pushing them out of the public space. And this is something that together, across generations, we absolutely have to work on, because this is where massive, more than discrimination, but exclusion of different age groups as well could happen. So this is something I think that we ourselves in the European Women's Lobby, we're currently doing a report on the different forms of online violence, cyber violence, because there are masses of them and different. I mean, I'm learning every single day when I read the report, but we need to be able to identify it to know what we're talking about, and then look at the regulatory sector as well. The platforms, they have responsibilities. It's not good enough to say that they're going to take note. We need to stop this as part of the continuum of violence against women throughout all of the generations. So I'll leave it at that for the moment. Thank you. Oops.
Well, on my part, maybe just a word to come back to where I'm speaking from. So we are ELC, which is the Euro Central Asian Lesbian Community. And so I may talk about LGBTQI plus perspective, but mainly LBTI perspective, because we use the word lesbian that covers broadly all LBTI, lesbian, bi, and queer women and non-binary and intersex persons that would find themselves in the word lesbian as in activism and identity. We are a feminist network, so of course all of this resonates with us a lot too. And in terms of achievement, of course, we are very happy also, like we also have the same reading over the last 5 years, that we are very, very happy to have had a commissioner, an equality commissioner, that it has changed a lot of things, that we really, really, really hope we are going to manage to have one in the next legislature. And we did have some very good strategies coming out of this legislature, the gender equality one, and the directive against on violence against women, for example, was really good, even though lesbians or LBTI women are not mentioned specifically. There is a part on LGBTQI identities, and how actually attacks that would be against someone who's LGBTQI as a punishment is considered as an aggravating circumstance. So that's very, very good. We're also very, very happy with the LGBTI strategy that actually mentions, it's very historical for us, but really specifically mentions lesbians or LBTI women. And for us, it's important because we are at the intersection of gender and LGBTI positioning, and we tend to fall through the cracks. I mean, it's the concept of intersectionality. We tend to disappear, and which means that, for example, lesbians organization and in general LBTI organizations are underfunded both by women rights movement and by LGBTQI plus movements. So we tend to be just forgotten, and we just tend to imagine that general LGBTI strategies or perspective or policies are going to trickle down and actually reach people who are also facing misogyny. And that is sadly not true. That would be great, but that's not happening. So we are very happy with how it's been going for the last 5 years. We would have wanted maybe, and we are going to push for more of this, I think, for more intersectional approaches to make sure that all of those strategies actually work together and that we manage to really find the tools to implement all of this. I think I'm going to leave it there.
Thank you. But what I hear from the three of you is that you're quite happy with the last 5 years and the development in the field, but still you see and you find a lot of challenges, a lot of things to be done in the future. Maybe I should say this again. I mean, when it comes to older people, this is the most diverse group of people you could possibly imagine. And I remember this quote from David Bowie, who a few years ago said, aging is this extraordinary process in which you become the person you have been meant to be. You're meant to be. And, you know, I see this, you know, what you say, you know, like when you combine this, with the process of aging, people really find the people they are meant to be. My other question was about a couple of United Nations documents, like the so-called Istanbul Convention on Violence Against Women or the UN Convention on the Rights of People with Disabilities. How do you see this? How do you see the existence of this document in relation with your work, your policies in Europe? And my other question would be, we have, policies, we have strategies, and what about, the link, the connection between existing strategies and practices in real life of people that we're talking about?
Okay, we go this way this time. So yes, thank you so much. The Istanbul Convention is absolutely essential, and we call it the golden standards. So really, really important. And it was something that we've been pushing for a long time. And the fact that it's beyond the EU as well, it also means now that the EU has actually ratified it, it's incredible. We now need to, it's only ratified it since last October, 2023, but it's now going to start the process of being monitored as well by the Grevio, which is the independent monitoring tool that's there. So we're really, really very pleased. The thing is, contrary to the UN Convention on Persons with Disabilities, not all of the EU member states have ratified the Istanbul Convention. So there are still 5 countries, one of which will never ratify, and I'm sorry to say it's your country, because in Bulgaria there was a challenge. It was challenged in the Constitutional Court, and which said that yes, it's not constitutional, and therefore, in reality, you need to change the constitution in order to ratify the convention. That's not going to happen soon, whether it ever will happen. And that's why the Directive on Violence Against Women, the EU directive, which we fought really hard, and as the European Women's Lobby, we've been fighting for 30 years. It was one of the first priorities we put on our agenda when the organization was set up back in the early 90s. Because right across the EU, every single woman and every single women's organizations, it is really a common thread that women share. And therefore, it's not a private affair. It has to be on the political agenda, and there had to be a response. So I can now say, whew, because it took us a long, long time. And it was up to the 24th hour because we almost didn't have it. Because, just for you to know, and this relates to every single woman and girl, no matter what their age, throughout Europe, the 2 member states consistently blocked the inclusion of an article on rape. They did rape on the basis of a lack of consent. That was France and Germany. Consistently, they would not put it in. They would not, they wanted it out. So in the end, we also had to compromise and say, okay, but because otherwise we would have jeopardized everything and we would have lost everything. And for those countries that don't have the Istanbul Convention, it would have even been worse as well. Because now we have the directive, which finally passed, adopted, is in the official journal. But also it says in the directive that it can be reviewed in 3 years after its transposition. So we have a 5-year window to work on getting the rape article back in, and forced sterilization and sexual harassment as well, which all of those were taken out. So just to say that the Istanbul Convention is, and we will be closely monitoring the EU as well on how it's implementing it and how it's being followed as well by the Grevio process. So yes, we need these international instruments because they put additional pressure. And it also means that right across the European Union, that we have the same rights and the same rights across the generations as well. And that's really, really important. So I'll leave it at that. Thank you.
Well, for us, obviously, as the CRPD is as well a golden standard, and actually the fact that the EU and all member states have ratified it actually makes it's a driving force for us and for disability rights, because it's part of the legal framework, and therefore the state parties to the convention are encouraged or obliged, better than encouraged, to really set their legal framework in line with the convention, which is obviously challenging, and it requires loads of reforms also on existing legislation before. But for us, having this convention as you know this driving force for disability rights at EU and national level has empowered many disability organizations to really be ambitious and to kind of pass that ambition to encourage their public administrations and their institutions to really echo that ambition in their roadmaps or strategies or action plans, whatever they call it. And another element which is for us very important is the review process, because by ratifying the convention, the state party also, in addition to having a monitoring framework, which in the case of the EU, for example, EDF, we are members of that independent monitoring framework, along with the Fundamental Rights Agency and the EU Ombudsman, and as well the European Parliament because of the Petitions Committee. That also has is a good, let's say, a good mechanism for us to push the agenda forward. But the CRPD committee needs to review the state party, and at the moment we are in the middle of the second review of the EU. We had the previous one back in 2015, in which the experts of the UN Committee on the Rights of Persons with Disabilities review what the state party has done to align with the convention, and then after discussions with the state party and a report from the state party and an alternative report from civil society organizations, constructive dialogues with the committee and the experts and so forth, the committee issues concluding observations, basically recommendations to the state parties. And that obviously for us is also another more full for our advocacy. And actually this can align with the current campaigns on the current challenges that we would like the EU to address. We expect, for example, that the current review, which is a simplified one, so it's a little bit shorter, will conclude in March next year, and by then we hope that the European Commission would have already confirmed their political will to update the current European disability strategy, because what I didn't mention before is that our current strategy includes actions and flagship initiatives from 21 to 2024, but nothing after that. It's like the second half of the strategy is not empty, because the objectives are there, but it doesn't have any time-bound action or any kind of flagship initiative for the coming years. But the strategy itself outlines the possibility for the revision, not the revision, but the update or the inclusion of further actions and strategies. So if you think of these two parallel process, at the same time, it actually gives us an opportunity to advocate for more, because the UNCRPD committee will review and outline certain recommendations that then the Commission should pick up. In the previous review, to give you an example on how it worked, one of the urgent recommendations was for the Commission to withdraw from the monitoring framework that I was mentioning before, because it didn't make sense that the Commission, which is the focal point for the CRPD, would be actually monitoring themselves. So the committee asked the Commission, please leave the monitoring framework, and the Commission did immediately. The committee also requested for the adoption of the European Accessibility Act, and soon after we got the Accessibility Act adopted. Maybe this was not as direct as the Commission withdrawal from the monitoring framework, but it can prove kind of the political weight that these human rights treaties can bring to the advocacy and the political work that we do.
Well, yes, again, I agree with the fact that these documents are extremely important. The Istanbul Convention is an essential piece of work. It's a formidable advocacy tool, especially because, again, there is a clause on anti-discrimination, which is going to say, you know, every woman, like independently on race, regardless of race, and disability, sexual orientation, and so on and so forth. And it's a very good door to open to actually go and look at where policies on women are trickling or not trickling, are attaining, are actually touching LBTI women. So it's a very, very important tool that we appreciate. Actually, we've published a research on the Istanbul Convention that's available on our website if you're interested in knowing more about that. And you also asked about how those strategies actually impact our, like the people around us. And actually, I wanted to draw on this, especially for older lesbians, because this is where we are. We are going to talk about age, so I'm going to talk about age. And as Mary was saying, women, like as women age, they become invisible. That's what you said. And it's true that for us, this is our main issue. We also published a research last year in March on older lesbians. And the first thing we learned with this report is that we actually have barely any data at all. That the data, like there is a huge, huge gap in knowledge, a terribly huge gap in knowledge. Our main data set usually comes from the FRA report for LGBTQI plus people and rights. And the 2019 report, at the time we used the 2019 report, and older lesbians constituted a mere, like a really meager 0.7% of the respondents, which is really not a lot. And of course, very, very badly spread around Europe. So we would have like the only usable data according to the standards from FRA would be from Ireland, Denmark, and the Netherlands. And that's like Western, Northern Europe. It's people who will have already like more rights, there is a big difference in there already. So we really, really have an issue with data. And we need more research, we need more funding to know more. But that was really the first thing that jumped is like, where are the older lesbians? Where are they? Do they exist? And we know they exist because we have a lot of member organizations. And so some of them work with older lesbians. And so we managed to actually have information and interview older lesbians. We managed also to identify I'm going to say 3 main issues they face, which is a lot, again, intersectionality. It looks a lot like what older women in general face. And then we have the little sprinkle of sexual orientation that adds more discrimination on it. The first one is, of course, socioeconomic, because as you mentioned, the pension, gender pension gap is huge. It's enormous. And it, of course, impacts women in general, lesbians even more in some ways, because they are generally not in relationship with people who are not women and who may be getting better pensions. So this is just furthering that whole. There is the issue of precarious employment, poverty, and so yeah, all the lesbians are battling those 3 things in like in the socioeconomic sphere. Then we have the access to healthcare, because we've learned that there is even more discrimination against LGBTI women in healthcare than against LGBTI men. So, and especially with older people. So that's, and that the third one is access to long-term care and housing. And this is really something we've noticed older lesbians are especially worried about, because we have, of course, we're battling rising prices everywhere and gentrification, but also there is a huge fear of rejection from families of origin, that could be their own, but also potentially the family of a partner they may be living with, especially if the partner is deceased or is sick, and then the family of origin may just basically kick out the partners and not recognize them. And there's also a lot of fear of discrimination in long-term care institution and in or facilities and in housing. So those are really like the main things we've seen until now, but we are really raising a flag on how the data is lacking, and even in the data we had, most older lesbians that were represented in the data were lesbians between 55 and 65. And then after that, again, they disappear. And so basically, and linked to the strategies, that's the real problem, is that we have strategies in place, but it's very hard to monitor how they're implemented if you don't have the data on how they're impacted by,
Can I just add something about data? Because we're very fortunate as well that we have the European Institute for Gender Equality, and they provide data from across Europe, from the official sources of data. So therefore, the data is comparable. And they have a number of different domains, as they say, work, care, etc., decision-making. And they have now started to compile it from an intersectional approach. So where there is data on age, where there is data on race, origin, etc., they are also analyzing the data from that perspective. And I think it's really worth mentioning this because sometimes we don't find that data in the official Eurostat statistics when in fact they're coming from the same source in a way from national level. And they have a gender equality index every year and shows you the progress in the different areas and gives a composite index as well. And just for you to know that we have progressed about 5% in the last 10 years. So we're still very much at a snail's pace. But I think it's really very much a source that we should certainly be looking at more and more, because it has the potential to bring in the intersectional approaches that we're talking about. And also the equality bodies also collect data. So there's masses of information out there, and they're obviously dealing precisely with different forms of discrimination and collecting data for that as well. So I think we have the resources. We just need to make sure that it becomes coherent and systematic as well. And I know that the Fundamental Rights Agency as well, constantly as well, providing a lot of data, and also on looking at the indicators of violence against women as well. So we have what's there, we need to boost it, and we need to value it, and really, I would say, give it the place that it really needs. And just finally about the strategies, we absolutely need strategies. I think we all would agree with that, because for gender equality, there was a 5-year period where there was no strategy. There was called an engagement, or what was it called exactly? Strategic engagement, but it didn't hold the same weight. It didn't put the same onus on all of the institutions at European level to actually put this on their agenda. It's really important. And what's really important is that the strategies talk to each other and that we join the dots. I think that's probably what's missing. For example, in the strategy on disability, there is nothing on women. So these are the kind of issues that we need to make sure that these are, as I say, talking to each other and coherent as well. And moving forward, we also can work together on this to make sure that there's a renewal of the strategy. And as you were saying, to make sure that the next period, it's blank in terms of actions, but that we now start pushing as well for there to be more actions on an intersectional basis as well. Thank you.
Thank you, all of you, very much, for this shared experience. And it goes without saying that, we're raising these questions in an environment, when age is currently working, for two things. One is European strategy on aging, because, there is a strategy, but some of us are women, some are not, some of us, have disabilities, some don't. But there's one thing that unites all of us, and this is we're going to be older persons sooner or later. So we need this strategy. This is one. And the other thing is, together with other organizations, Age Platform Europe is also working on advocacy for UN Convention on the rights of older people. So what you shared with us is really, really interesting. And I very much like the a term that someone used in the previous panel. It was living instruments. So I take this, point about living instruments, strategies and regulations, like living instruments, something that is developing. And now I want to turn to the audience and give you all the chance to raise your questions. There's someone and there's...
I'm Bernard Bazot from France. I would like to thank Mrs. Collins for speaking of women made invisible. You're perfectly right, Mrs. Collins. But we should be careful at the same time not to make a large proportion of women made more invisible because hidden by some activists who concentrate on minorities. I especially think of all these women who are widows and they were married with farmers, with small shopkeepers. They worked very hard helping their husband all along their lives and they become widows. And since they haven't been regularly paid as pensioned, etc., their pension is very small. They have not a driving license because in their time, the women didn't drive. They let their husband drive. And suddenly all these women, thousands, millions probably, are isolated with very small pension, not able to drive. And I would be very happy in the next forum, EDGE would invite somebody to represent these women. We probably are millions and millions all along the European Union. Thank you.
Oh, thank you. My name is Arina Angerman, and I managed to go to Brussels before the launch of the gender equality strategy. I'm a 65 plus feminist, to say it. And now I wanted to thank Mary Collins for mentioning Simone de Beauvoir, because when I started to become a feminist, I read her book in English and I told about it. But that's a personal remark. My question is, how is digitalization envisioned in the equality strategies in the next 5 years? Because I agree with Mary Collins that you need to have data, and now I'm 65 plus, so I'm invisible in the data. And if I get at the end of this period, I probably will be 70 plus, and I still be invisible. So my question is, how is digitalization in the new strategy of the European Union and in your organization as well? Thank you.
Hello, Ionuț Ardelanu, National Federation of ENEA from Romania. Just a quick question. It may seem a bit off topic, but I'm pretty sure it's not. Are you aware of some progress regarding mental health policies at the European Union level, since it's becoming more and more of a problem affecting all age groups and especially older adults? Thank you.
Okay.
Please, we have to reflect also about poverty of caregivers. They are mainly women, and we know that the studies are getting a different way of being woman in Europe because we have more access to university, to career projects. But when we get children or we become caregivers, everything changes for us. And I have to say I'm a caregiver, and my future about pension, about security and whatever is really, really low. And in Italy, this is ordinary way. We have to project about that because we need to be caregivers in different ways, but we can't forget it. We are more invisible twice.
Could I ask you for very short answers, I mean, to any of the questions you?
Yeah, you go first.
Okay, so very briefly on digitalization, indeed, the Commission and the EU and most member states, they are investing loads of resources and political weight for this transition, which is indeed not a transition anymore, on further digitalization. In this case, we can really look at whether the mainstreaming of different groups actually works. And we see some initiatives in which, okay, they take into account, for example, accessibility for persons with disabilities and older people, such as, for example, the proposal on the digital euro that H is very active on. But we also see others which are very important for the everyday life of people, like Artificial Intelligence Act or the Digital Services Regulation, in which they didn't actually address the specific situation of older people or persons with disabilities. We as EDF, we do work on this on this digital agenda, trying to ensure that accessibility will be considered. But obviously, what we see and hear from our members increasingly more is that, okay, it's fine to have digital tools, but it's not okay that these digital means are the only way to access services of general interest or public services. So what happens for someone that simply don't want, because it's not accessible, or simply because they don't want to use these digital means? People should have access to these services of general interest. And therefore, we are in one of the proposals of our manifesto, we are proposing that the EU regulates some sort of like internal market legislation to ensure that these kind of services, public services or services of general interest, will have the access through digital means, but also through non-digital means, because we have the right to access them regardless of the means we use them. And concerning mental health, the EU has recently launched a communication, if I'm not mistaken, on mental health. One of our members, Mental Health Europe, has been working on it. It's not as ambitious as they expected and we expected. There is some references to persons with disabilities and, if I'm not mistaken, older people, but I would need to check, so if we can be in contact and I can send you the information on this initiative.
Yeah. Okay. Thank you. I'm going to answer the remark about women made invisible by focusing on minorities, because especially women living in rural areas, because I agree that we should definitely talk about that and that they are probably a majority. But the thing with minorities is that majorities are composed of minorities. We are everywhere. These women who are isolated, I mean, some of them are queer, some of them are disabled, some of them are like, and there are men in there, but they're also women. And of course, the notion of class isolation, rural areas is extremely important. The fact that you are connected or not, the fact that you can have access to your everyday, to everyday needs, whether it's food, shelter, administrative connection, or even human connection, which is very important too. So I just want to debunk the idea that when we focus on minorities, we are actually not talking about majorities, to the contrary. And the more we talk about people who have multiple minorities, people have multiple barriers, that's the magic of intersectionality. I like to talk about the unicorn. You know, you look at the person, you think that this person does not exist. If we focus on the need of a trans Black woman who is disabled and older, you're going to be like, oof, no, this person cannot exist. There's too many things. And maybe she's also a caregiver, like, no, this person cannot exist. But let's entertain the thought. Because first and foremost, I guarantee that person exists. But also, if we focus on her, then we are going to solve barriers that other older women face, that other women in general, other caregivers, other trans people, other people of color are facing too. And so focusing on multiple minorities is actually usually much more efficient at tackling majority problems than focusing on just the big groups that we identify without looking at it closer.
Yeah, thank you very much. I think it is about breaking down the barriers and really the stereotypes that are still very much anchored in our society. And, you know, regardless if we're moving into a digital world, those stereotypes are coming with us. So I think it is about that. Just to pick up on a couple of things, the widows, issue around widows, I think that's going to become even more intergenerational as well, because in conflict and war, many women, young women of different ages, will become widows as well. So I think it's a theme that needs to be also looked at from an intergenerational perspective. There are many other issues, as you pointed out, in rural areas, women farmers who are helpers, seen as helpers, have no particular status of their own. And yet, when they do find themselves either divorced or in the situation of widowhood, have nothing. So these are the issues that the Common Agricultural Policy as well should be addressing as well. And also in terms of care, I think you've pointed out really specifically, it is a massive issue. And for the European Women's Lobby, we call for a care deal for Europe, which acknowledges that we have a collective need as a society and a collective responsibility. And it should not be put on the shoulders of women only. And therefore, both women and men throughout their lives should have the possibility to step in and step out. And also it means massive investments in the care economy and through the resilience funds, through the budgets, etc., of the European Union. But also we see it as very much part of a green economy and the Green Deal, because it is a sustainable economic model moving forward, and it does respond to societal needs. So we're pushing for that in that sense, but you're absolutely right, because otherwise we're left in the situation of dire poverty. Finally, digitalization. Yes, it's our massive, I think, challenge moving forward. I think one of the issues as well, it's going so fast, so fast as we speak. It's actually changing. So it's how do you keep up with that, and how do you make sure that nobody is left behind? And I mean, in this case, I think it really is meaningful to make sure that everybody has the access in different ways, and that it's not becoming a blockage rather than something that's supposed to liberate us and make life easy. But I don't know for whom it's easy at the end of the day. So these are the kind of things we need to watch from an intergenerational perspective. I think we can work on these issues together. I hope I have picked up on most of the issues. Mental health as well, just to say, I think you already mentioned it, but it's also actually the EU per se doesn't have a competence in the area of health. But what we can see is obviously you can't ignore it. It's part of everything we do. And it's important that it's on the table and that it's acknowledged and that we face it together as well. Thank you.
Thank you, all of you, for really deepening our understanding and knowledge in a number of intersectional issues. And also this type of multiple discrimination that so many people around us actually face on a daily basis. What I heard, like in a summary is data. We need data on different levels, and also leadership, cooperation, and advocacy, working together. Thank you very much.
Thank you.
I want to now invite our president, Heidrun Molotov, and the panelists of the last panel of today's conference. I'm not sure this one is. Fine.
Can you have a moment to listen, please? We are very honored to have the Polish minister with us, and she will speak in her language, in Polish, and you can hear the interpretation through your headphones. So please provide yourself with the headphones so that you can follow her speech. Thank you. Channel 2 for years. No, okay. Again, a very warm welcome. No, it does not work. Okay, now, yes, good, thank you. I have now the task, the pleasure, the honor to welcome you all to our final panel. And I have a high-level guest with us. First of all, welcome to you, Mrs. Oh, I have to read it. I cannot do it by heart. Yes, Miss Okla Drevnovic. Yeah. You are the Minister for Senior Policy of Poland, and you came to meet us here and to talk to us here just for this meeting. So thank you very, very much. We also have, yeah. Next to me is sitting Ms. Sirpa Rautio, Director of the European Fundamental Rights Agency. Thank you as well for being with us. And I also welcome Mr. Patrick Charlier, Chair of the Equinet and Director of UNIA, the Interference Center for Equal Opportunities from Belgium. Thank you for coming. So this morning we had already quite a lot of discussions, important topics raised. And just to remind you, I noted a few keywords and how they are connected to each other. For instance, the connection between aging
discrimination, ageism, poverty, and loneliness, or not enough data making older persons invisible, or no equal treatment of people in the medical sector, with the consequences of lower health, lower services, and less health, especially for older women, because medical treatments are mainly on the basis of investigations with younger males. So these are just a few topics we raised. I heard in the last panel also that some organizations, representatives of organizations, are quite satisfied with what has been developed during the last 5 years. But at the same time, that it is so important to have good legislation, reliable strategies, monitoring of the implementation, and all these instruments that help us to, yes, to bring aging and aging on an equal level with others to the fore, and to secure equal rights to all ages. So this is what I heard from this morning and what I took with me. So let's see in this final panel of the conference what we can hear from you, what we can get from you as recommendations, what to do next, what are, in your vision, in your perspective, the possibilities, the options, first to increase visibility and improve the situation in your respective organizations or policies, but also how you can imagine to work together better. So first of all, I would like to ask you, we prepared question for all of you. So my first question is to you. You hold a key position within the Polish government in developing aging policies. In your view, what needs to be done to improve protection from age discrimination and secure fundamental rights in old age? As we are approaching the Polish presidency of the EU, what do you see as challenges and opportunities on the way ahead? The floor is yours. Thank you for talking to us.
Bardzo dziękuję na początek. Szanowni Państwo, to dla mnie wielki zaszczyt, że mogę dzisiaj z Państwem być, bo też przy okazji chciałam podziękować za tę dotychczasową pracę na rzecz budowania polityki senioralnej. To bardzo ważne. Rzeczywiście jest tak, że w polskim rządzie po wygranej, czy też po zmianie po 15 października pojawił się po raz pierwszy w historii minister do spraw polityki senioralnej. Tak się złożyło, że ja mam powierzoną tę funkcję i dzisiaj moim wielkim marzeniem jest zbudować tak politykę senioralną, żeby ona opierała się przede wszystkim na solidarności międzypokoleniowej i żeby polityka senioralna była postrzegana jako wartość, żebyśmy odpowiadali na wyzwania dotyczące starzejącego się społeczeństwa w kategoriach właśnie wartości, a nie obciążenia. I to jest możliwe. Z jednej strony rzeczywiście jest tak, że możemy kłaść nacisk na tworzenie rozwiązań legislacyjnych i przygotowywanie dokumentów, ale z drugiej strony, biorąc pod uwagę to, że tak szybko się starzejemy, jako właściwie cała Europa, musimy równocześnie, w mojej opinii, wprowadzać konkretne czy wdrażać konkretne działania i od razu posługiwać się konkretnymi narzędziami. Wiem, że czasu nie mam wiele, więc zaproponuję od razu przejść do konkretnych przykładów, co już na dziś udało nam się zrobić, czy też do czego jesteśmy dzisiaj przygotowani jako Polska, jeśli chodzi o budowanie, odważę się powiedzieć, nowoczesnej polityki senioralnej. Otóż rzeczywiście tę funkcję objęłam 13 grudnia. Jutro mija równe 6 miesięcy, pół roku, odkąd ją sprawuję. Zaczęłam, można powiedzieć, od siebie tylko, bo nie miałam żadnego zespołu i mój urząd to nie jest resort, więc nie mam departamentów i jakiejś rozbudowanej struktury. Na dziś mogę powiedzieć, że jest nas tylko 10 osób, w tym 5 osób takich naprawdę merytorycznych, ale zaraz będzie nas więcej. I jak ja widzę to podejście do tego, abyśmy zmieniali w ogóle podejście do osób starszych, żebyśmy mogli przeciwdziałać ageizmowi i dyskryminacji. No nie ma innego wyjścia. Trzeba rozpocząć od edukacji. Oczywiście trzeba zawrzeć tę zasadę w dokumentach strategicznych, ale też równocześnie musimy już podejmować konkretne działania. I ja już dzisiaj wspólnie jako minister do spraw polityki senioralnej, wspólnie z panią minister edukacji przygotowujemy program, który ruszy jesienią pod nazwą Szkoły międzypokoleniowe. Ideą tej szkoły będzie to, aby uczniowie już na poziomie szkół podstawowych mieli zajęcia wspólne z osobami starszymi. To, co dziś jest problemem dla osób starszych, to oczywiście wykluczenie cyfrowe. A kto najlepiej potrafi przekazywać tę wiedzę, jak nie wnukowie. Więc pomyślałam tak, żeby to była wspólna przestrzeń w tych szkołach, które chcą do tego programu wejść, żeby ci uczniowie na przykład uczyli osoby starsze, jak korzystać z tych nowoczesnych technologii. W zamian za to też mogą nauczyć się innych umiejętności, które są im nieznane. I dzisiaj wspólnie z Ministerstwem Edukacji i Ministerstwem Cyfryzacji, które to posiada środki w ramach Krajowego Planu Odbudowy, które tak jak wiemy niedawno zostały dla Polski odblokowane, mamy środki na to, żeby prowadzić takie zajęcia od jesieni. I myślę, że przez taki choćby konkretny program możemy pokazać młodym ludziom, że to starzenie się, to wszystko jest naturalne i możemy i dla wszystkich to jest korzyść, aby te wszystkie pokolenia rzeczywiście mogły w tej szkole znaleźć wspólną przestrzeń. A więc zaczynamy od edukacji, ale od edukacji nie teoretycznej, tylko absolutnie praktycznej. To może jest takie, wydaje się, małe działanie, ale jak ono będzie powszechne w całym kraju, to wtedy krok po kroku będziemy mogli zbierać jednak te efekty właśnie w wyniku tejże edukacji. Kolejna kwestia to jest właśnie ageism, dyskryminacja, rynek pracy. I dziś widzimy często już tę sytuację, że osoby po 50 roku życia są gorzej traktowane na rynku pracy i tak powoli zaczyna się schodzenie z tego rynku pracy. I jaki na to sposób? Ja od razu przechodzę do konkretnych działań, które u nas już są zmaterializowane w postaci konkretnego projektu ustawy, który zaproponowałam mojemu rządowi na pierwsze 100 dni rządu. Przygotowałam ustawę o wspieraniu rodziny i o bonie senioralnym. Jest to ustawa, dzięki której osoby, które potrzebują opieki w miejscu zamieszkania, w sytuacji, kiedy jej potrzebują, a jej bliscy pracują, są aktywni zawodowo, w tej sytuacji my jako państwo z budżetu państwa, czyli tak naprawdę z podatków tych, którzy pracują, zapewnimy usługę w miejscu zamieszkania. W ten sposób chcemy pokazać, że osoby, które mają największe prawdopodobieństwo, czy też prawdopodobieństwo opieki nad osobą starszą, mają zabezpieczenie ze strony państwa, że mogą na tym rynku pracy pozostać, bo ktoś w zamian za nich, z ich pieniędzy tak naprawdę, będzie mógł zaopiekować się tą bliską osobą. A więc z jednej strony pokazujemy, że osoby po 50 roku życia to wcale nie jest tak, że będą schodziły z tego rynku pracy, czy najczęściej są to kobiety, które w tej sytuacji rezygnują z pracy, tak jak to często bywa u nas właśnie w Polsce, albo przechodzą tylko na część etatu, albo też płacą prywatnej opiekunce czy opiekunowi w tak zwanej szarej strefie, bo często właśnie nie ma tutaj legalnego zatrudnienia, ale też w sytuacji, kiedy ktoś z bliskich zostaje na rynku pracy, a osoba starsza wymaga opieki, no to przecież tę opiekę ktoś musi sprawować. I tu jest właśnie to tworzenie miejsca pracy na rzecz tych przyszłych opiekunów. Więc myślę, że takie pokazanie też pracodawcom, że te osoby starsze, 50, 60 lat mogą zostać, nie muszą opiekować się, bo nie będą zmuszone do opieki albo do szukania jakichś innych rozwiązań na rzecz opieki nad swoimi bliskimi. Oni będą siłą rzeczy atrakcyjniejsi, czy dalej atrakcyjni na rynku pracy, ale też jest inna kwestia. Otóż zwróćcie Państwo uwagę na to, że często tę opiekę nad osobą starszą sprawują kobiety, które już są na emeryturze, które już zakończyły swoją aktywność zawodową. A my mówimy tak, i właśnie w charakterze tej opiekunki, tego opiekuna może być ta osoba, która bardzo często zeszła z tego rynku pracy i opiekuje się w sposób nieformalny w szarej strefie tą osobą bliską starszą. A jak damy na tę usługę publiczny pieniądz, to będzie opłacało jej się, czy ją się zatrudnić w sposób formalny. Dzięki temu to będzie odprowadzenie z powrotem do budżetu państwa jakiejś części pieniędzy, liczymy, że to będzie 1/3 w ramach tego właśnie finansowania bonu senioralnego, wróci do budżetu państwa z powrotem w postaci podatków i składek. I jest jeszcze inna wartość, mianowicie są też dzięki temu, że ona będzie, czy on, mówimy o opiekunie, legalnie pracować, dzięki temu będzie mógł sobie zwiększyć kapitał swojej emerytury i ta emerytura będzie mogła być przeliczona i będzie dzięki temu wyższa. Pokazuje korzyści, bo staram się przekonać do takich rozwiązań właśnie, które będą budować srebrną gospodarkę, a bez zbudowania srebrnej gospodarki my nie przekonamy pracodawców czy też młodszych pokoleń do tego, że osoby starsze i starzenie się jest czymś naturalnym, a tak naprawdę jest wartością. Musimy pokazać tę solidarność pokoleń i pieniądz. I to jest możliwe poprzez kolejne bardzo konkretne działania. Dzięki temu mamy też nadzieję na pobudzenie tego potencjału, który drzemie w społeczności lokalnej, bo wykonując tę opiekę na rzecz osób starszych, my musimy szukać opiekunów. Ich mamy bardzo mało i to w każdym kraju, więc musimy poszukać, gdzie jeszcze możemy go tak naprawdę znaleźć. Największym wyzwaniem jest wsparcie dla osób starszych w miejscu zamieszkania na obszarach wiejskich. To jest wielkie wyzwanie. Dziś właśnie mogę użyć wręcz takich słów, że starość na wsi to bardzo często twarz samotnej kobiety. I teraz jak my jej możemy pomóc? U nas w Polsce mamy różne organizacje, najczęściej kobiece, nazywamy, czy też mają taką nazwę, koła gospodyń wiejskich, które są dość aktywne. Najczęściej ich aktywność jest, powiedziałabym, kulinarna, kulturalna. A dlaczego nie opiekuńcza? Jeżeli za to im zapłacimy z pieniędzy, tak jak podkreślam, nas wszystkich, dziś jestem też po rozmowach z nimi, one mówią, dlaczego nie. Oczywiście musimy wszystkich naszych potencjalnych opiekunów przeszkolić, ale my potrzebujemy opieki dość szybko, właściwie tu i teraz, więc wiadomo, jakość opieki musi być zagwarantowana. I wszelkie szkoły podyplomowe, rozbudowane programy kształcenia są potrzebne i dla tych, którzy chcą się dłużej, stale i bardziej profesjonalniej zajmować opieką nad osobami starszymi, tak, ale my potrzebujemy też szybkich takich przeszkoleń, prostych kursów 30-godzinnych, tak zapisaliśmy w ustawie, uczących pierwszej pomocy, rozmowy z osobą starszą, umiejętności funkcjonowania w środowisku, więc przewidzieliśmy, że zanim zapłacimy za tę usługę, to każdą taką opiekunkę, opiekuna przeszkolimy w ramach właśnie takiego 30-godzinnego kursu, który będzie finansowany ze środków unijnych, bo wtedy łatwiej jest zachęcić nam kogoś do zostania opiekunem, jeśli nie musi wydać swoich pieniędzy. Więc budujemy system. Dziś w Polsce, jeśli chodzi o politykę senioralną, zaczęliśmy od budowania, czy też od tworzenia rozwiązań systemowych i budowania systemu. To jest ważne. Kładziemy nacisk na system. Oczywiście pozostawiamy wszelkie transfery finansowe, które były i będą, natomiast naszym priorytetem jest budowanie systemu opartego właśnie na srebrnej gospodarce w usługach, ale nie tylko, bo tutaj zabrakłoby mi czasu, gdybym mówiła również o tym, jak ważne są nowoczesne technologie i wdrażanie ich choćby w zakresie opieki długoterminowej, ale to trzeba byłoby odrębny panel, więc pominę. Ale zaczynamy właśnie od srebrnej gospodarki w usługach, od budowania tej solidarności pokoleń i jeszcze kończąc powiem o kolejnym przykładzie, jak będziemy tę edukację realizować, oprócz tej szkoły pokoleń, która będzie takim wymiernym przykładem i dosyć naocznym. W tej chwili trwają prace w Ministerstwie Edukacji dotyczące zmiany podstaw programowych i między innymi planowane są takie przedmioty jak edukacja zdrowotna i edukacja obywatelska. I ja jako minister do spraw polityki senioralnej też już jestem na etapie przygotowywania propozycji właśnie do wprowadzenia w podstawy programowe treści, które będą dotyczyły osób starszych, starzenia się, demografii i absolutnie przeciwdziałania ageismowi. Więc zaczynamy od edukacji, od solidarności międzypokoleniowej poprzez konkretne działania pokazujące młodszym pokoleniom wartość starzejącego się społeczeństwa. My musimy zarazić, myślę, trochę naszym entuzjazmem i wiarę w to, że jesteśmy w stanie sobie poradzić, bo to jest nasza wspólna sprawa. I uważam, że jest to możliwe. Taką atmosferę staram się wprowadzać w Polsce. Tutaj też jest przedstawiciel, pan Przemysław Wiśniewski razem ze mną, który jest z Państwem działa od dłuższego czasu, a jest też u nas w mojej Radzie Spraw Polityki Senioralnej, bo tworząc ten urząd postawiłam na bardzo duże konsultacje i szeroki dialog z ludźmi, którzy jeszcze przed rządem, mogę powiedzieć każdym, położyli takie kamienie milowe, jeśli chodzi o politykę senioralną. Będziemy czerpać z tych doświadczeń i to jest fundament powodzenia, żebyśmy mieli wsparcie w zrozumieniu i w realizacji tego przedsięwzięcia. Bardzo dziękuję.
Thank you very much as well from our side. I found it very fascinating what you are doing and trying to implement within a short time frame and with so little resources. And I think this is one of the best examples I heard how we spend European money. I think this is really something worth doing it. I especially was interested in your mentioning the intra-generational schools and also the combination of working life ageism or preventing ageism and combining it with the care duties of people still working. And the idea to make women, especially after retirement, employees for caring, I think this is an idea which really should be thought about by other countries as well. So thank you very much again. Now I would like to give the floor to Sirpa Autio. You have been appointed to this task some time ago, and you know that several years ago, the Fundamental Rights Agency launched an important report calling on a rights-based approach to aging. And for some time, we haven't heard about that any longer. And we would be interested to hear what you think could be done in the future to revive it. Thank you.
Thank you very much. I would also like to start by thanking H Platform, the organizers, for the invitation, which I very happily, took upon. I have been on this post only 3 months and a bit more, so I'm a bit over 100 days. And I've spent a lot of time getting to know the agency and the activities. I had been working with the agency before in different capacities. I was in the Finnish Parliament, Director of Human Rights, and I had a program on older persons' rights and also mandate for disability. So the topic as such that we're discussing today is not unknown, but of course the role is new. And I have had to, of course, quickly try to understand what are the possibilities for FRA to further improve the implementation of fundamental rights. Of course, as an EU agency, we work mainly with EU law and policy and with all the EU institutions, but we also should have impact at the national level. And these are some of my priorities, that in particular, trying to find a way through partnerships, networks, to work on broader range of issues effectively. Of course, while preparing to come here, I had a chance to look at what we have been doing. And there are 3 reports. The 2018 on rights-based approaches to aging. Of course, everything we do has to be promoting rights-based approaches. Some new issues have been mentioned. AI Act, recently passed, also the Digital Services Act, and also the corporate sustainability. Within all of those new EU files, we are very active, looking at the implementation guidance already. And well, my first response would be that this has been a very, very rich discussion, feeding right into my head a lot of ideas and perfect timing. You really caught me at a sensitive moment, because we are in the process of planning. I'm looking at 24 even, because there are still possibilities, but then 25 in detail. What should be the priorities? Can we change something? And then 26 is still fairly open. But I can assure you that rights of older persons, also rights of persons with disabilities, will be high on my agenda. But across what we do, including the new areas, artificial intelligence mentioned in the previous panel, also Digital Services Act, also access to justice. I think there are many things we can do. FRA has been mentioned many times, and it's often in relation to data collection. And I took careful note of what you were saying about our most recent survey, LGBTIQ survey. We launched it here, not here in Brussels, only about a month ago. And I did ask, a colleague was helping me, can you tell me a bit more about sort of how much information we have in the new survey about older persons, and this is 55 plus, which I consider a little bit too young actually to be called older persons. There are possibilities to get more information, but you were absolutely right that at the different countries provided very different level of responses. But anything we do on data, we always have age as one of the factors. Gender is another one, and we're also looking at young people and children from the same angle. We have many surveys. We are working on a huge survey on violence against women at the moment with EIGE, also was mentioned, the EU gender agency. We work very closely with them, and also with Eurostat, and this will be launched in September. And our age gap for that survey is not 65, it's 74. And I was informed that for any other surveys, we haven't had age limit. So there are different ways. I'm not a data expert or survey expert, but we are doing a lot of also qualitative data collection interviews, precisely because the sort of push to web type of doing surveys doesn't capture people who are not digitally able to respond. So we take note, and this has been almost like not living instrument, but living feedback loop, directly giving ideas. But what we can do more is, of course, also look at the EU policies. And I think while preparing, I'm used to running an independent agency. So independence will be also key to me, while we are extremely cooperative, and especially we have a sort of regulatory responsibility to request at the request of Commission or Parliament or Council to help with data. We also, I think, have to be prepared for the eventuality that there wouldn't be requests that are always relevant, and also have our own initiative and any ideas where data is needed, which is sort of not covered by the main policies or strategies. This is also something we need to be looking at. So I think that would be my first answer. I don't want to be too long. I know Patrick, my good friend, will talk more about the equality and AIDS discrimination, I'm sure. So thank you very much.
So thank you very much as well. I have, when listening to you and the different options, I have some hope that there will be some change, I think, with regard to data also, because this would cover one of the other topics we discussed this morning already, invisibility of older persons and especially of older women. So now let's turn to you, Mr. Charlier. The question to you is, what do you think that the outgoing EU legislature has missed when it comes to its equality infrastructure that should be strengthened by the next Parliament and Commission? And what is the role of equality bodies in this journey? The floor is yours.
Thank you. We missed the horizontal directive. That's clear. That's a quick answer to your question. But speaking about equality bodies, so Equinet is a European network of equality bodies. We have 47 members from 38 countries, and this is far beyond the EU country. And as equality body, it's important to say that we are working on non-discrimination and equality. Non-discrimination and equality is a part of human rights, but it's not all of human rights. The parallel has been done between equality and non-discrimination and the CRPD Convention on Disability. The fundamental rights of the human rights of persons with disability is broader than non-discrimination. And it's important, speaking about older persons and speaking about the human rights of older persons, is broader than discrimination. Non-discrimination is an important question. That's the first thing. The second is the fact that as equality bodies, we are working on several grounds: age, sexual orientation, gender identity, religion and belief, racial discrimination, and so on. And it's interesting to make a comparison between the discrimination grounds, because the stereotypes and the prejudice are not the same ground by ground. And on age discrimination, there is one singularity that you can't find in other grounds, and especially in employment. You have in employment some measures, some regulations, some rules that are protecting older workers. Protection against dismissal, possibility to work, to reduce work time without losing salary, and so on. But it's the same regulation, the same rules that are excluding older people, older workers who want to go in the... And so the same regulation is protecting and excluding in the same time. And I think it's the only ground where you can have this sort of findings, and it's a form of paradox, of course, because the measures protecting but are excluding. And that's something which is a challenge, I think, speaking about age discrimination. Our work in the equality body shows that there is discrimination on basis of age in employment, but also in goods and services, access to bank, insurance, and so on, but also healthcare. We produce a document on equality and non-discrimination, and especially after the inquiry, it showed that in healthcare, there is a form of discrimination, of inequality on basis of age. And also with intersectional approach, older women are more discriminated in healthcare than the other. And that finding that we see according to the work what we are doing. In Equinet, we have an age cluster. It's a working group with our members working on age discrimination and exchanging experiences, producing some research and so on. And this cluster shows that it's important to have consistent laws and adopting consistent laws, but also to apply and to enforce the existing laws, because there are laws, but they are not applied. And it's important to support the application of the respect of the laws. Secondly, we need a monitoring and reporting system and data. We have also already spoke about that. And I would like to underline that it could be interesting to use data mining algorithm to detect discriminatory patterns that you can't find through individual cases. It's hidden discrimination, using data collection and mixing data to detect a form of structural discrimination, of systemic inequalities that are hidden, and you can't find it with individual cases. And that's one of the opportunity of recommendation that we can do. And of course, speaking about laws and regulation, I have already answered, we need horizontal directive beyond employment discrimination in goods and services and in other life area on age, but also other ground, non-racial ground, it's important. And we also want to stress the importance to adoption of the Convention of the Human Rights for Older Persons. It's important, and that's a finding. And I will be honest, it's an evolution that we have had. And after the COVID-19 pandemic, before we were not so supportive for such a more convention. But after the pandemic, it was clear that the need of such a convention is important. And the parallel with the CRPD and the added value of the CRPD for the fundamental rights of people with disability is the same that for people for older person. And especially, I think, the fact that in the CRPD convention, you have the monitoring body. We have heard about EDF spoke of the monitoring body. I think a monitoring body for people for older person is also something which can be very important. And at the EU level, you have already heard that there is a new regulation standard for equality body that has been adopted. It's for us important, but for us, the work is beginning now. It's a transition phase, and we will see how the different country will transpose those directives. They are 2 to 1. And I would like to repeat something that I've already said. Those standards directive is not for ourselves. It's to better protect the person who are victim of discrimination. It's not because we want to be more independent, to have more resources. It's to serve the citizens that are facing discrimination, and especially age discrimination, and perhaps the added value of equality body, and it's something which is in this directive, is in the case law, the possibility to litigate. And we have some experience litigating when there is a form of discrimination that is against the law, and giving some findings and saying, okay, that's not allowed. But, and that will be my last point, it's also the idea that discrimination of basis of age, the prejudice of the stereotypes are different. And it's sometimes more easy to have alternative dispute solution in age discrimination than in other discrimination, because there are no a form of hatred, if we're speaking of a religion, of racial, there is something which is coming from here. But age discrimination is something else. And if you are dealing with individual case, it's sometimes more easy to find an alternative dispute resolution by the conciliation, by mediation, than other grounds. And that's also something that an equality body can support.
Yes, thank you very much. Again, very good report, good ideas. I was fascinated about the contradiction between protection on the one hand and exclusion on the other hand. And I think we can use this ambivalence also for other issues. For instance, when we talk about digitalization, it's on the one hand very positive, very useful, especially for persons with disabilities. And at the same time, it can be a barrier, a too high barrier for participation of other persons who are not able and willing to use it. Yeah, thank you very much. Yeah. So would you like to respond, to react to one of your co-panelists? Maybe, yeah.
Just very briefly, of course, we're looking forward to working with the Polish presidency, and we already discussed a little bit more going to Poland in September. This is what we always do to make sure that FRA expertise and data can also feed into the presidency program. So this is already agreed. For Patrick, I mean, I used to be chairing the European Network of National Human Rights Institutions, and they co-locate with Equinet. So I know equality bodies and the other national human rights institutions and ombuds very well. And I'm very happy that you said that, you know, equality bodies are not answer to everything. It's extremely important to combat discrimination, but not everything within human rights field can be looked at through the lens of discrimination. We need to talk about access to rights, and this is why I think cooperation is extremely important, that we have to, whatever we do, we should be looking at, you know, access to rights, and then whether there is discrimination, and therefore we need a broader set of institutions to address these issues. That would be my brief comments, but very happy to, of course, continue to work with you and Equinet.
Bardzo wnikliwie przysłuchiwałam się wypowiedziom i mogę powiedzieć tylko tyle, że te doświadczenia, które są za nami, to tak naprawdę jest to jest dobra diagnoza do tego, żeby przystąpić już do konkretnych działań. Tak to odbieram. Myślę, że prezydencja, która będzie w Polsce, będzie taką dobrą okazją do tego, żeby już zaprezentować jakieś pierwsze rekomendacje. Ja będę mogła zdać, mam nadzieję, efekty pierwszych działań, ale myślę, że rekomendacje do stworzenia dokumentów międzynarodowych to będzie właśnie ten moment. Natomiast wypowiedzi, których słuchałam, wskazują według mnie oczywiście bardzo jasno na to, że my musimy jednak dużo uwagi poświęcić na tę edukację. Okazuje się, że te regulacje, tak jak tutaj słyszeliśmy, z jednej strony powinny pomagać, a tak naprawdę przeszkadzają, nie do końca pomagają. Więc myślę, że większy i lepszy efekt osiągniemy wtedy, kiedy ta świadomość w społeczeństwie po prostu będzie zmieniała, a ona może się zmieniać przez edukację. I myślę, że to jest taki kierunek dla nas wszystkich, który nas na pewno połączy, a nie podzieli. Dziękuję.
Don't so like to answer?
Yes, I think that we have to think about how to address the contemporary challenge for other persons, but it's for everybody, but specific for other persons. We spoke about digitalization. That's something which is very important. And after the pandemic, everything is possible with digitalization. It's really an added value, but we don't have to lose anybody on the road. There is a research that has been made in Belgium by the King Baudouin Foundation that shows that 40% of the population, 40, has difficulty with digitalization. And we are stressing that it's important to digitalize, but to keep an individual human contact. And it's also addressing the question that you raised before about the loneliness. If you are behind your screen or with your phone, you don't have any more human contact, and I think it's important. The second challenge, contemporary challenge, is the climate change. What are the consequences of the climate change and also the regulation that has been taken to avoid the climate change? And for example, all the question of the low emission zone in cities where it's no more possible to drive some cars, and it gives some difficulty for people in vulnerability that can't be mobile anymore because of those regulations, and we have to pay attention to those questions. I think that's two main issues for everybody, and especially for older persons.
Thank you. Then I would like to open the questions for the floor. Who would like to ask or to comment on what you heard? Yeah, please.
Thanks very much. I'm afraid that I found all the comments extremely rich, and it was very interesting to hear about the experience and the different work. I wanted to flag another opportunity where I felt the inputs from the people on this panel would be particularly important. And that is that in July, on the 3rd and 4th of July, there is a high-level conference on the European Social Charter that is due to be held in Vilnius. And as I was saying in my comments earlier, this includes a wide range of rights provisions, specifically on older persons' rights, but also rights that apply to older persons. And I think that conference and participation, for instance, Henri Equinet and Frau are having a joint meeting around it. Many ministers, we've a huge number of ministers from Council of Europe countries coming, Frau's involved. It is a really good opportunity to push forward some of the issues here using the rights framework and the language offered by the Social Charter that doesn't arise elsewhere. And the reason I flag it also is because it's also a situation in which it's about saying that when you're talking about, this will be about social rights and the social charter, but it's about making sure that older persons and their rights get proper attention within that broader discussion. Because one of the things we've seen is there's huge interest in talking about children, younger people's rights in times of conflict, reflecting Ukraine, the climate crisis, etc. But there's very, very little on older persons, despite the excellent work we've heard about the commitment to intergenerational conversation. So I really would, to the extent that I can, encourage people to engage with that and to encourage their own, for instance, domestic ministries to engage with that in order to make sure that the really important issue of older persons' rights is front and center at that event. But thank you so much for that. And I apologize, it's not more of a question, but more of a what I think you should do comment.
Yes, but thank you for your advice and recommendation. We have more questions, yes. First, Philip, and then over there, yeah.
Here we go. Yeah, okay. Philip Hammerrods from Finland. I will continue some with this about digitalization and its impact upon discrimination or equality. I am happy also to see that Mrs. Tapiero from United Nations is here. She was in the previous session talking about the Summit for the Future, which has direct contact to what you are doing in the European Union. And as a part of it, there is the efforts to achieve a global digital compact. And understanding about how to give equal possibilities and easy access to digitalized world. My question to you is, digitalization of economy and society. Do you see that it's bringing more risks for discrimination of older persons, or do you see that this digitalization is bringing limiting limiting this discrimination? As I mean, more in general terms, that is to say, how to take care of also these equality values in the virtual world, which is here and will be more in the generative technologies. Thank you.
Okay, yeah, let's see whether we have more questions. I think in the back, and then you. Yeah. And then you can answer.
And hi, I have a question for the Minister Okla Drenovich. First of all, to say that I guess in Europe, we're quite hopeful about the model that Poland has assumed with bringing in a specific minister of senior policy. That's it's a very unique model. So we're very hopeful that this could be a good practice for other countries and other regions in the world. So following up on the comment by Professor Nolan, I want to know to what extent is the policy design that you're proposing based on rights? To what extent is it a human rights-based approach to policy making for older persons or in old age? And also, how are the voices of older people included in this policy design? Thank you.
So we take one question more, and then first let you answer.
I'm Dimos Andoniou from Cyprus. Excellent panel, excellent presentations. And I want to congratulate the minister for her approach to the problems of older people. And since Cyprus is following Poland in the presidency of the European Union, I think we should work together as age from NGO perspective and the Cyprus government, because to combat ageism and to give the human right to older people to dream about an active, healthy, and dignified aging, which is very important for their well-being. I mean, in Cyprus and in the rest of the Europe, we have many problems that if we cannot sit together as governments, as NGOs, and through age, we cannot achieve anything. This is my approach.
Yeah. Yes, thank you. So now it's up to you. Would you like to start this time?
To think about digitalization, I think that digitalization is something, such as you underline, it can be positive and negative. But I think it's not an or question, it's an and question. It's digitalization and something else. Of course, digitalization is very helpful, can be very efficient. We can receive quicker answer when you are applying for something. It's very easy for, I think, all the society, but we don't have to forget anyone who has some difficulties to access to rights. The second thing is just to say that there is a form of acceptance of to make a difference between age more than other grounds. And just giving one example that we have had in our body. It's a woman from Afro-descent woman who applied for a job and came and say, I've been discriminated. We wrote to the employer and saying, okay, it seems that you didn't accept her because she's from Afro-descent. And the employer answered, no, absolutely not. It was not a racial discrimination, but she was too old. And so we had the proof the demonstration that there was a discrimination, and we convinced the judge that there was a discrimination basis of age.
Odpowiadając w kwestii właśnie samego powołania Ministra Spraw Polityki Senioralnej, w ogóle bardzo dziękuję za te nadzieje i budujące słowa. To dla mnie takie nobilitujące. Natomiast skąd wzięła się w ogóle ta idea? No, abstrahuję może od tego, że ja od dobrych kilkunastu lat jestem w parlamencie i zajmuję się polityką społeczną, w ostatnich latach senioralną, a zanim zostałam posłanką, parlamentarzystką, przez wiele, wiele lat pracowałam w pomocy społecznej, w Urzędzie Pracy i zawsze zajmowałam się sprawami polityki społecznej, polityki senioralnej. I od lat mówiłam też premierowi obecnemu Donaldowi Tuskowi, że seniorzy i polityka senioralna to jest coś, czym absolutnie musimy się zająć. To będzie największe wyzwanie. I tak mówiłam, a premier jest bardzo otwarty na tego typu merytoryczne sugestie. I można powiedzieć, że to się udało. Udało się dla ludzi. Skąd w ogóle ten pomysł? To nie jest mój pomysł, że był osobny urząd. To jest głos osób starszych, bardzo silny w ostatnich latach w Polsce. To osoby starsze mówiły tak, że chcemy mieć takiego swojego rzecznika, najlepiej przy premierze, kogoś, kto nas wysłucha. I druga kwestia, sprawy związane z osobami starszymi w Polsce to przede wszystkim dwa resorty. Z jednej strony Ministerstwo Rodziny, a z drugiej strony Ministerstwo Zdrowia. Dwa odrębne resorty, które prowadziły i prowadzą odrębne, niestety dość niezależnie zadania, czy też na rzecz osób starszych. I chodziło o to, żeby skoordynować te różne działania, tak żeby one się nie dublowały i żeby się te resorty na rzecz osób starszych widziały. I to był wielki problem. Więc ja dostałam zadanie koordynacji pracy, szczególnie właśnie jeśli chodzi o te resorty, ale nie tylko, jeśli chodzi o podejmowane przez nich działania na rzecz osób starszych. Ale moje uprawnienia wynikające z rozporządzenia są dość szerokie. To nie jest tylko koordynacja, to jest przygotowywanie dokumentów strategicznych, to jest opracowywanie różnych analiz, to jest inicjowanie różnych przedsięwzięć i również podejmowanie projektów legislacyjnych. Także jestem ministrem bez resortu, ale z dość szerokimi uprawnieniami i fizycznie jestem bezpośrednio w kancelarii premiera. To jest, powiedziałabym, dość mocne wsparcie w ten sposób. I teraz pytała Pani o głos osób starszych. Pierwsze, co zrobiłam, to powołałam Radę do Spraw Polityki Senioralnej przy ministrze. Wcześniej też była taka rada. Ona składała się z 30 osób. Nabór do niej trwał dość długo i tyle osób, ile się zgłosiło, było w tej radzie. Ja skróciłam czas naboru z 3 do miesiąca. Uznałam, że w tym czasie może się za mało osób zgłosi, więc uznałam, że dam taki limit, minimum 15 osób do 30. Okazało się, że zgłosiło się prawie 200 osób i miałam problem z wyborem tych 30 osób. Było tak wielkie zainteresowanie. Więc dzisiaj przy ministrze tym do spraw polityki senioralnej działa Rada do spraw polityki senioralnej, która jest złożona, czy też w skład której wchodzą nie tylko przedstawiciele osób starszych, czy też organizacji senioralnych. Nie, wchodzą również w skład tej Rady przedstawiciele różnych środowisk, które działają na rzecz osób starszych. To są przedstawiciele uczelni, przedstawiciele samorządów, przedstawiciele pracodawców, po to, by tworzyć politykę senioralną na każdym etapie. Ale szkoda mi było potencjału tych ludzi, którzy chcieli z różnych części Polski współpracować ze mną przy tym urzędzie. Więc pomyślałam sobie, że skoro oni się zgłosili i chcą za darmo, ta praca nie jest w żaden sposób płatna, się angażować, poświęcać swój czas, a i tak to są ludzie mocno zaangażowani z ogromnym doświadczeniem, postanowiłam ich potencjał wykorzystać w poszczególnych województwach, regionach. U nas w Polsce mamy 16 województw i ci ludzie byli z różnych województw, więc zaprosiłam do siebie wszystkich wojewodów, którzy zarządzają tymi regionami, są przedstawicielami rządu w terenie, żeby po pierwsze w każdym regionie powołali swojego pełnomocnika do spraw seniorów i żeby teraz ci pełnomocnicy zaprosili tych, którzy chcieli współpracować przy moim urzędzie, zaprosili ich do siebie i żeby stworzyli takie zespoły ekspertów do spraw polityki senioralnej w regionach. I w ten sposób tworzę taką organizację parasolową w całej Polsce, przedstawicieli, no, począwszy od tej Rady do spraw polityki senioralnej przy moim urzędzie, poprzez właśnie te wszystkie regiony, w których będą zespoły ekspertów właśnie złożone w skład których wchodzą właśnie ci, którzy chcieli współpracować ze mną, ale nie tylko. W ten sposób będziemy mieli taką organizację, dzięki której będziemy szybko mogli konsultować różne projekty ustaw, ale też dzięki którym będziemy zbierali oddolnie różne sprawy, problemy i propozycje. Więc myślę, że stworzymy i do końca czerwca to tworzymy. Więc myślę, że dość szybko, a od 1 lipca będziemy już konsultować w ramach konsultacji międzyresortowych i publicznych ustawę o wspieraniu rodziny i bonu senioralnego i właśnie te zespoły i ci wojewodowie będą mieli wielki wpływ właśnie na te konsultacje. Więc głos osób starszych i organizacji senioralnych będzie bardzo słyszalny, jest już, oni są zaangażowani w ten cały proces. A jeszcze na koniec mogę dopowiedzieć, że wynikiem tego, że jest właśnie minister do spraw polityki senioralnej w Polsce, jest również taki efekt pozytywny jest również w tym się objawia, że zgodnie z Krajowym Planem Odbudowy mamy kamień A70 poświęcony opiece długoterminowej. Koordynatorem tego kamienia miało być Ministerstwo Zdrowia. No do tej pory było. Oczywiście we ścisłej współpracy z Ministerstwem Rodziny, ale ta współpraca nie jest łatwa i kamień też jest dość trudny. I żeby usprawnić realizację tego kamienia, czy też w ogóle, żeby go zrealizować, teraz właśnie w ramach rewizji Krajowego Planu Odbudowy zaproponowaliśmy Komisji Europejskiej, żeby to właśnie mój urząd, Minister Spraw Polityki Senioralnej, był koordynatorem tego kamienia, czyli opieki długoterminowej, która tak naprawdę jest podzielona między zdrowie a pomoc społeczną. W związku z tym, no taka moja dzisiaj rola. I tak też się dzieje, właśnie to konsultujemy, więc myślę, że ja nie wiem, jak będzie za kilka miesięcy, czy też za kilka lat, ale mam nadzieję, że rzeczywiście takie osadzenie takiego urzędu właśnie na pewno może przy takim wspólnym działaniu i wizji pomóc w stworzeniu polityk senioralnych w poszczególnych krajach i przenieść się na grunt Parlamentu Unii Europejskiej. Dziękuję za długo.
Yeah, no, it's up to have time. Not.
It was important to hear. I only have very short time, so I'll try to be very brief. On the human rights-based approach, I take you were perhaps meaning how do we hold EU accountable to fundamental rights, and I would like to mention just a couple of things. Fundamental Rights Charter, which of course includes also social rights. It's directly binding on all EU institutions and at the national level when they implement EU law. So that's the scope. So we already have that, and that's why we are working on these fundamental rights compliance, guidelines, and also monitoring the implementation through various means. But there are also other ways to hold EU accountable. Istanbul Convention was mentioned, and that EU had acceded to that, and also the CRPD, and in fact, Fundamental Rights Agency is part of this monitoring body, and one of my first measures that I took was that I wanted to see what are we doing, is it functioning well enough? There are issues with it. It's not as effective as it could be. And of course, there's also overlap to older persons because there are categories of older persons who should be considered to be also benefiting from the CRPD if they are functional, deficiencies. And then finally, EU is hopefully acceding to the European Convention on Human Rights. So there would be sort of the final guarantee that human rights would be always taken into account in EU law and policy. On the digitalization, just very briefly to answer my colleague from Finland, I think some of the consequences we already know. It's not perhaps even discrimination, it's almost total exclusion of older persons when everything has gone digital. In Finland, I think there is at least requirement for parallel channel. The Ombudsman has been insisting on it, but whether it works in practice, it might be very difficult. The other side of digitalization and big data, artificial intelligence, is that it's going so fast, and I think Women's Lobby mentioned that we don't even know the consequences. And this is where we have to be quick. There is now regulations, AI Act, Digital Services Act, and others, but we need to make sure that they are implemented in such a way that they are not, creating bias by algorithms. Of course, also impacting on older persons. And again, we are working on that, but it's going fast, and it's a huge area because by one mistake you can, take away the rights of millions of people. So this is my shortest possible answer to those questions.
So thank you very much as well. I think we could continue with the discussion with questions and issues for more than an hour, but I'm afraid we have to finish our conference. I have to already apologize for the interpreters that we took more time than expected, but I think it was worth listening to you, also to the morning sessions. And altogether, I think we have such a variety of good instruments, of already existing laws and legislation, strategies. So why do we still have gaps or missing links in between? Why do we still have discrimination and ageism and abuse, violence, and so on? So what do we really need? I think we have to continue to ask this question and to ask for more binding instruments. So with this, I would like to thank you again. I'm looking forward to continuing this discussion. I'm looking forward to the Polish EU presidency next year. So I think we have quite a lot of things we can look for, but also what we have to fight for. And with this, I would say thank you again. Thank you all for being here, for listening, for your patience, for your contributions. And yeah, hope to continue with all of you in a joint effort. Thank you very much.
Yes. Thank you so much. And see you again next time.
Yeah, my colleagues were attending this meeting
Okay. Okay. And tomorrow there is an anti-Muslim hatred meeting organized by the Belgian presidency. So.
I'm sorry. It was long. No, but it was so interesting. It was so interesting. Yeah, thank you so much. Thank you so much. All the best. Yeah, all the best. Yeah.